बताने सर नमस्कार. दीप्ती मॅडम.
सर उधर से लॉग आउट करोगे तो आपका यूट्यूब भी लाइव स्ट्रीम करेगा. आपने वो डिवाइस से किया है. हाँ 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 ऐसे मुझे लग रहा है. आप देखो.
नमस्कार दत्ता पाटील साहेब.
नमस्कार नमस्कार.
गुड मॉर्निंग.
गुड मॉर्निंग.
तो आप वहां से मुझे
सुंदरच काम चालू आहे बा.
सुंदर काय तुम्ही कामालाच लावलंय.
येस
काय
सर.
म्हणता बाकी.
निवांत निवांत. युट्यूबला चालू झाले ना अजून.
नाही नाही.
सुंदर ते ध्यान वाटायला.
सकाळी सकाळी केलताच पंक्चर तू पाठवते. त्यांनी दुसरी लिंक तयार केली. असं चालेल ना. त्याला जाऊन असं हे सोपं पडतंय का. मी आणली होती कुठे गाडीतच राहिले होते. कुठे लावू. ओके डायरेक्ट कनेक्ट. हा अच्छा अच्छा हे आहे. अच्छा अच्छा हे असं आहे ना. आता कनेक्ट करायला लागेल ना याला.
कनेक्ट केलेलं मग त्यांना सांगा. ते आता जे ऑलरेडी जे झालंय लाईव्ह स्ट्रीम त्याला डिलीट करायला लागेल. लोक तेच बघतील. विचारा संदीप सर.
रजिस्ट्रेशन किती आले बघ बरं.
सर तुमचं म्यूट करा पाहिजे.
ते व्ह्यू झालं ना.
एकदम तुम्ही हे जे आहे ना तुमचं
हे सांगतो.
डॉक्टर वालीवाडीकर.
सर म्यूट असतो.
म्यूट नाही केलं.
गुड मॉर्निंग सर. गुड मॉर्निंग.
पॉट्स कानात घाला.
हो थांबा माझे गेले मी तर बाहेरच काढले. हॅलो.
गुड मॉर्निंग सर.
गुड मॉर्निंग. काय म्हणतात सर, कशात?
बस चांगला आहे सर, व्यवस्थित.
काय म्हणते लातूर?
लातूर चांगलं हेवी रेन आहे सध्या.
हो का?
हा.
बोला दुष्काळ.
आवाज येत नाही ना. गुड मॉर्निंग सर.
गुड मॉर्निंग. गुड मॉर्निंग. काय म्हणतात प्राचार्य महोदय, पवार सर?
असं पब्लिकली विचारायचं नसतंय.
तुम्ही दिसत नाही साहेब,
ठीक आहे.
चेहरा दाखवा.
दिसतोय का सर?
हा दिसलं. पाटील सर.
नमस्कार सर्वांना.
नाही इथे पाहिजे ना.
नमस्कार सर. नमस्कार. शेटे सर.
हा
नमस्कार.
सर. नमस्कार. नमस्कार सर.
नमस्कार सर.
नमस्कार सर. गिनोडे सर.
नमस्कार.
इनोडे सर नमस्कार. डॉक्टर बताने
सर नमस्कार. सर
सर नमस्कार.
नमस्कार सर. डॉक्टर शिंदे औरंगाबाद.
नमस्कार सर. नमस्कार.
शिंदे सर नमस्कार.
नमस्कार बताने सर.
सावंत सर जॉईन व्हायचे बहुतेक. पहिल्या सेशनचे चेअरमन डॉक्टर सावंत सर जॉईन होतील आता लगेच.
सर त्यांना बोललोय 2 मिनिटात होती.
हो.
दत्ता पाटील सर. गुड मॉर्निंग.
आवाज कुणाचा? शिंदे सर.
शिंदे औरंगाबाद. नमस्कार.
व्हेरी गुड.
पाटील सर.
हा
डीन सरांना आणि प्रोविसींना कल्पना दिली.
दिली. शिंदे सर जॉईन झालेत म्हणजे डीन सर जॉईन झालेत असं समजू आपण.
थँक्यू सर. पण सर काही दिसले नाही मला, खाली पाहिलं मी. डिपार्टमेंट मधून जॉईन झालो.
काय म्हणजे सरावर वॉच ठेवूनच आहे तुम्ही.
नाही नाही, येताना बघितलं सहज.
मुळे सर जॉईन झाले का? चंद्रशेखर मुळे सर. हे कुठे गेले? आणि रेशमा दोघांना नाही.
शिंदे सर
हा सर.
बघा 3 दिवसापूर्वी लिंक पाठवली आहे भताने सरांनी आणि
हो, हो.
आजच्या सेशनचे चेअरपर्सन जे आहेत माननीय
हा, हा.
डॉक्टर सावंत सर काय
हा हा
11th आवरला सूट कसा शिवून घ्यायचा काय
हा हा हा. त्या गडबडीत फसले. शासनाची माणसं आहे सर ती.
काही विषय नाही. Yes, छान.
आपण सगळे शासनाचेच आहे.
एक
गुड मॉर्निंग.
येस सर.
डॉक्टर दीपक सावंत सर, नमस्कार. गुड मॉर्निंग.
नमस्कार. गुड मॉर्निंग. गुड मॉर्निंग. हाऊ आर यू सर? हाऊ आर यू?
फाईन 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 सर. काय म्हणतो उस्मानाबाद?
किती स्मार्ट.
आवाज ब्रेक होतोय तुमचा.
हा एक मिनिट सर. हा एक मिनिट. आता येतोय का?
हो हो येतोय.
Am I audible sir?
पण थोडा ब्रेकच आहे.
ओके ओके ओके.
दीपक सर, हेडफोन
बोला.
वापरा.
आपलं
इयरफोन लावा, म्हणजे साऊंड ब्रेक नाही.
येतोय का? थोडा ब्रेक होतोय.
चला ना, तुम्हाला बोलवलं.
अशी एक प्रिंट काढून तुमच्याकडे घ्या.
हा युट्यूबवर नाही, ते लिंक होती ना, झूम केले. हा केले झूम वर.
चांगला आहे. चांगला आहे.
सँडविच इडली पण मागव.
सावंत सर नमस्कार.
नमस्कार सर. गिनोडे सर कसे आहात?
बस मजेत सर. फाईन सर.
चांगलं वाटलं बघून.
हो
कॉंग्रॅच्युलेशन.
मलाही सर. इन्स्पेक्शन नंतर आता आपली वेळ झाली ऑनलाईन मोड वरती.
लॉंग ड्युरेशन.
लॉंग ड्युरेशन.
आय थिंक.
येस येस सर.
डॉक्टर राघवेंद्र कोल्हापची सर जॉईन झालेत का? दत्ता सर.
शिंदे सर नमस्कार. शिंदे सर नमस्कार.
नमस्कार. गुड मॉर्निंग.
गुड मॉर्निंग.
वा, छान वाटलं.
मला पण तुम्हाला छान वाटलं. पण थोडं पाहिजे थोडस.
काय म्हटलं सर?
इम्प्रोव्हायझेशन कोट टाईप जरा तुम्ही पाहिजे होतं.
काय हरकत नाही.
पाटील सर.
कुणाची नाही ना?
सावंत सर.
गुड मॉर्निंग सर. गुड मॉर्निंग.
सर गुड मॉर्निंग. सर दत्ता पाटील सरांमुळे आणि तंत्र शब्द कॉमन असल्यामुळे अगत तंत्राचा माणूस आज एक दिवसासाठी शालक्य तंत्र सोबत आहे.
क्या बात आहे, व्हेरी नाईस. तंत्र म्हणजे सायन्स आहे सर. सायन्सेस.
येस 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 सर.
सर तो आज मला थोडस मला एकदा गाईडलाईन द्या बरं, म्हणजे मला थोडस हे करता येते. आपल्या कशाबद्दल आहे? सायंटिफिक रिसर्चच आहे ना फक्त?
हा सर, स्टेप्स ऑफ रिसर्च.
स्टेप्स ऑफ रिसर्च.
ज्या 7 स्टेप्स सांगितलेल्या ना, त्या 7 स्टेप्स मी डिस्क्राईब करणार आहे. आता 45 मिनिटाचा वेळ दिलेला आहे, पण त्यात मी कव्हर करायचा प्रयत्न करतो पूर्ण.
नाही काही प्रॉब्लेम नाही, काही प्रॉब्लेम नाही. आणि सर फक्त काय करायचं, त्याच्याशी काही तुमचे शालाक्य किंवा ENT ऑप्थॉल्मशी रिलेटेड काही एक्झाम्पल्स वगैरे आहेत का?
नाही सर, नाही. मी ऍक्च्युली 2 दिवसाच्या ड्युरेशन मुळे मला टाकता आले नाही सर ते. आमच्याकडे इन्स्पेक्शन होतं 2 दिवस, शुक्रवार शनिवार, आणि सरांनी फायनल टॉपिक मला शुक्रवारी सांगितला, आणि गुरुवार शुक्रवार आमच्याकडे CCM इन्स्पेक्शन होतं. त्यामुळे शालाक्याचे इन्कॉर्पोरेट करू शकलो नाही मी. जे ऑलरेडी काही आहेत त्याच्यामध्ये, काही प्रसूतीचे आहेत, काही अजून वेगळे, ते तसेच म्हणजे ठेवलेले मी त्याच्यामध्ये सर.
काही प्रॉब्लेम नाही.
त्याच्याबद्दल एक्स्ट्रीमली सॉरी सर. शालाक्याचे काही घेऊ शकलो नाही मी त्याच्यामध्ये.
गिनोडे सर.
हा सर.
वालेवाडेकर बोलतोय.
नमस्कार सर. नमस्कार.
तुमची कमिटी आमच्याकडे पाठवून द्यायची लगेच, आम्ही मोकळे झालो असतो राव. दीपकजी नमस्कार.
नमस्ते, गुड मॉर्निंग. कसे आहात?
बरे आहात? चांगला आहे.
अरे चांगला आहे.
या लातूरला.
लातूरला कसं येणार? तुम्ही बोलवतच नाही आम्हाला.
अरे काय बोलवतो, थांबा थोडं, या महिन्यात बोलवतो. शेटे सर नमस्कार.
योग आहे का?
योग
आहे का?
आहे, योग आहे. शेटे सर नमस्कार. पंकज शेटे सर
नमस्कार सर.
नमस्कार.
शेटे सर नमस्कार. गुड मॉर्निंग.
नमस्कार सर.
गुड मॉर्निंग टू एव्हरीबडी.
गुड मॉर्निंग.
दत्ता पाटील सर.
आवाज नाही, म्यूट आहे.
नाही मग याच्यात बघ, याच्यात असेल काय झालं.
गुड मॉर्निंग मोरे सर. रवी मोरे सर.
मोरे सर कुठे आहेत मोरे सर?
गुड मॉर्निंग.
ही जॉईन जस्ट.
मोरे सर नमस्कार.
नमस्कार सर. नमस्कार
सर. नमस्कार.
सर मोरे सर नमस्कार. ज्येष्ठ शालाकींना नमस्कार. ज्येष्ठ शालाकी.
ज्येष्ठ शालाकी लिजेंडरी.
असं करून त्यांना वयस्कर करा झालं.
नाही सर,
सगळं ना.
दत्ता पाटील सर गुड मॉर्निंग. थँक्यू फॉर गिव्हिंग ऑपॉर्च्युनिटी टू वी पीपल.
रजिस्ट्रेशन.
जस्ट यू आर कमिंग अँड गोइंग.
येस सर. येस सर.
मोरे सर गुड मॉर्निंग.
गुड मॉर्निंग सर. सावंत सर.
गुड मॉर्निंग. व्हेरी गुड मॉर्निंग. हाऊ आर यू सर? हाऊ आर यू?
फाईन सर.
व्हिडिओ ऑन.
मोरे सर गुड मॉर्निंग.
गुड मॉर्निंग. गुड मॉर्निंग.
मोरे सर कसे प्रिपेअर्ड आहेत? ऍप्रॉन वगैरे अगदी व्यवस्थित.
मास्क पण आहे.
मास्क पण आहे. मुंबई करायचे. जास्त प्रिकॉशन.
ओपीडी मधून आले ते.
नाही पण ते नांदेडला पण घालायच होते माहितीये का?
जेव्हा कोरोना नव्हता तेव्हा पण
हा.
डिसिप्लिन रे आहेत.
गोरे सर गुड मॉर्निंग.
हा गुड
गुड मॉर्निंग.
मॉर्निंग सर. गुड मॉर्निंग.
गुड मॉर्निंग अतो.
सर गुड मॉर्निंग.
गुड मॉर्निंग.
गुड मॉर्निंग.
हॅव अ टी सर.
लेट्स एन्जॉय.
आभासी पद्धतीनं आभासी पद्धतीनं ते चहा प्रत्यक्ष बाजूला तुझ्या
त्यांचा भासीच आहे, आपल्यासाठी आभासी आहे.
काय सर भासीच आहे, तुम्ही पण घ्या असं म्हणतोय मी प्लीज.
नाही आवाजात नाही कुठं.
दत्ता पाटील सर, आवाज येतोय माझा?
येतोय सर, बिलकुल सुरू करा. काय
प्लीज प्लीज.
10 झालेले
तुमच्या
आहेत.
आदेशाची वाट बघतोय
सर, काही विषय नाही, तुमच्या डिपार्टमेंटचे वेबिनार आहे, प्लीज डू स्टार्ट सर. एक्सपेक्टेड सगळे लोक आलेले आहेत. युट्यूब लाईव्ह चालू करून घेऊन सुरू करावं सर.
युट्यूब लाईव्ह झालेलं आहे.
ओके,
वेट करत होतो आपण सांगितलं ऑनरेबल.
नाही त्यांनी खटी सर आलेले आहेत औरंगाबादला. काय सर, खटी सर एका कार्यक्रमासाठी औरंगाबादला आले. देशमुख सर सोबत आहेत. काय हा, त्याच्यामुळे तुम्ही सुरू करा कार्यक्रम तोपर्यंत. आणि आपण यावेळेस औपचारिकता काहीच ठेवलेल्या नाही आहेत. इथून पुढं काय डायरेक्ट 4 सेशन आणि म्हणजे औपचारिकता बाजूला ठेवलेल्या आहेत. ठीक आहे सर.
ओके, थँक्यू.
फक्त जमलं तर धन्वंतरी स्तवन तेवढं घ्यावं प्रत्येक फर्स्ट सेशनच्या सुरुवातीला, असं प्लॅन आहे.
हो हो हो, चालेल चालेल सर, सुरू करूया मग. सुरू करू सर मग.
कमी आहे
पाटील सर,
सुरू करा सर. 10 झाले.
ओके.
फिवर कधी आलेला? काल परवा.
We are starting the session today's national webinar. Kindly mute the
काय नाही ना.
mics.
सॅट्रोजिल को टॅबलेट सॅट्रोजिल को प्रिस्क्रिप्शन नाही.
I request all of the dignitaries to kindly mute the mic. We are starting the today's seminar. The first session will be started. Thank you for cooperation. On the occasion of the Azadi Ka Amrit Mahotsav, the Independence Day, we are celebrating in this year 2022. On this occasion, the Association of Management of Ayurvedic Medical Colleges of Maharashtra, the government colleges, government aided colleges, private colleges, the NIMA, Vishwa Ayurved Parishad, Ayurved Vyaspit, NASA Students Forum, all together in collaboration, we have arranged this national webinar. This national webinar is on recent advances in eye ENT disorders and importance research methodology statistics. The subject itself, it's a self-explanatory. I think all the speakers, the chairpersons, co-chairpersons, secretary, coordinators, the distinguished delegates, principals of colleges, and other delegates, and my dear students who were on the YouTube live. This seminar is for the students, especially the PG students and the PhD students and who were in the research field. This seminar is endorsed by the Director of AYUSH, Government of Maharashtra, Maharashtra University of Health Sciences, Nashik, and Maharashtra Council of Indian Medicine of Mumbai. On this occasion, for this seminar, have been blessed and consented by Honorable Vice Chancellor, Lieutenant Colonel Madhuri Kandikar Madam, Director of AYUSH Directorate, Dr. Goinji Khatti, the Pro Vice Chancellor, Dr. Milind Nikum, our Faculty Dean, Srikanji Deshmukh, our friend and the best coordinator we have, Dr. Datta Patil. A lot of pain has taken and the initiative has taken by the management and especially the Dr. Datta Patil to arrange this webinar. We have started this kind of the activities from the Charak Jayanti, and this is the second program we have been arranging. I think this of the webinars are very much essential in a medical education. The continuous medical education should go.
आपला आवाज ऐकू येत नाही आहे.
Technical problem.
Yeah. I have been interrupted. Sorry for the inconvenience. So I think this kind of the seminars are very much essential for the all fraternity of Ayurveda. The research is going on, new things are coming, and the updates are very much essential. The stakeholders, our stakeholders are the students who are the aspirants of the Ayurveda, who want to learn many things to be in a newer manner also. So our aim should be to make them skillful, and in the future also they can practice very well in the Ayurveda in a society. Therefore, I request all the speakers, the chairpersons, co-chairpersons, coordinators to take the initiative and make this seminar in a success and in an appreciable manner also. So once again, I welcome to all the speakers, the principals, and the chairmen, co-chairpersons, the secretary, and the coordinators. I thank because this opportunity given by the association, and especially that responsibility by the, so I think not wasting the time, and people are eager to listen to all the speakers also. Once again,
thank you.
Very much thank to all the members who have given the opportunity to us, our college department. On behalf of thank you very much. Now the first session will be conducted, and for this session we have
Sir, you are not audible.
Dr. Pankaj Shetty, sir, continue with the first session, please.
Thank you, ma'am. Good morning to all. Welcome to all dignitaries, honorable guests, and participants. This year, we are celebrating the 75th anniversary of independence. Hamara AYUSH-Hamara Swasthya and Ayurveda for nutrition is the theme of this year. Today, we have gathered for the national webinar on the topic recent advances and in eye and ENT disorders and research methodology and statistics. First of all, I invite our secretary of first session, Honorable Milind Gore sir, for introduction of our guest speaker.
Thank you. First of all, I will thanks the organizer for giving me opportunity to introduce Dr. Atul Ginode, who is at presently working as an associate professor and head of the department at Ayurvedic College, Ocular. He has completed his graduation in 2003 from Government Ayurvedic College, Nagpur. His post-graduation Agatantra, MD Agatantra from Tilak Ayurvedic College, Pune. He has completed his PhD degree from Tilak Maharashtra Vidyapit in 2018. He is also working as Associate Professor of Research Methodology and Statistics Department for UG and PG courses. He is also member of International Ethical Committee. He is also working as a member of Board of Studies at LNCT University, Bhopal, Madhya Pradesh. He is working as a subject expert for PhD Doctoral Research Committee at Parul Institute of Ayurveda, Parul University, Vadodara, Gujarat. Also, PhD Doctoral Research Committee at Dattamake Indian Medical Institute of Science, Ayurvedic College, Wardha. He is member of editorial board for peer-reviewed journals for approximately 10 journals. He is honored as a guest speaker for more than 12 webinars at various institutes which were organized in various states. He has published 2 books, more than 10 articles in peer-reviewed journals. He is on exam panels of 7 universities of various states. His total teaching experience is of 14 years and postgraduate experience is of 3 years, 9 months. He is an eminent and hard worker person. Thank you.
Thank you, Gore sir. I invite our speaker, honorable speaker, Mr. Dr. Atul Ginode sir. His topic is guidelines and steps in research process. Atul Ginode sir, please.
Sir, please make me host so that I can share my PPT.
Okay, sir.
Co-host.
Yes, sir.
PPT share
Yes, sir.
करायची. दिली आहे का आपल्याला गिनोडे सरांची?
त्यांना host करा, ते करतील.
त्यांना host करा.
Sir, you are the co-host. You can share the PPT.
Okay, sir. Fine, madam. Thank you. Is my screen visible, sir?
Yes, sir.
Yes. And am I clearly audible?
Yes, sir.
Yeah, yes, sir.
Yes. Okay, sir. Thank you. So, good morning, one and all.
Yes, sir.
Thank you, respected Dr. Gore sir, for this wonderful introduction. So, before we start, I would like to thank the organizing committee members for giving me this opportunity to present this topic on this platform. So, without wasting time and with permission of chairman and co-chairman of the session, I will begin today's topic. Shall I start my session, sir? Dr. Sawant, sir?
Yes, start, sir.
Yes. Okay.
Yeah, start.
Yes, okay. Thank you, sir. So, topic today is guidelines and steps in research process. So this is Dr. Atul Ginode from RT Ayurvedic College, Ocular. So what are the, sir, my second slide is visible, sir?
Yes, sir.
Learning
Yes, sir.
objective and, yes, yes. So
Yes,
that
sir, but
can
it
be
is
continued
blank.
now. Yes, yes, it is blank. I will project it step by
Okay,
step.
okay, sir.
Learning objective and declaration. So learning objective is we are going to see the definition, areas and types of research. Then 7 steps of research process with their guidelines. And the declaration is some points will not be discussed in detail due to time limitation, as I have allotted 45 minutes to cover this topic, as it is very lengthy topic, but I will try to cover it in 45 to 50 minutes. And this presentation has 39 slides, including takeaway message and thank you slide, and it will take approximately 45 to 50 minutes to complete. So please be patient. So first we'll see definition of research. So what is the meaning of research? You all know, as we all know, re means again or new, and search means to examine. Okay. And so what are the components of complete components of this definition? Systematic. It has definite set of procedures and steps, which we are going to see later in later slides. So systematic, then organized. It is well defined structure. It has well defined structure. So it is organized. Then finding and answers to the questions of the research is the end of all research, and finding and answers of what? Of specific questions. So specific questions is the central to the research, because research without questions has no aims. So what we saw, what is the definition of research? What is the meaning of research? Then why it is conducted, finding and answers to specific questions, and how it is conducted in systematic and organized way. So what is the complete definition of research? So research is a systematic and organized method of finding and answers to a specific questions. Okay. So what is the main objective? As there are many objectives of the research, but as per this lecture point of view, the main objective is to gain new and useful information or knowledge on a particular issue, particular health issue, that is the disease of interest which a researcher want to study, right? So 5 major areas of research. So first one is literary, means a critical research work on classical textbooks. Then fundamental research, it is the research carried out to deepen understanding of basic principles. Then pharmacological research, study of effects of drug on living organisms. In drug research, participants are requested to please mute their mics. Drug research, testing the drug on safety, efficacy and quality control parameters, and it is performed in vitro and in vivo mode. That is, we can say it is a pre-clinical studies. And then clinical studies, study of health and illness in human volunteers. So these are the 5 major areas of research where we can study. Then types of research. So by nature of research, conceptual or theoretical research, and second one is empirical research. So conceptual research is related to abstract ideas or theories, and empirical research is based on observation, experience and experiments. Another type is by application or purpose. There is subtype fundamental, basic or pure research, and applied or action research. In previous slide, we saw the meaning of fundamental research, that is research carried out to deepen understanding of basic principles. So it is called basic or pure research also. And applied or action research, research used to answer specific questions or immediate problems, like for COVID-19, right? Then by methodology or approach, again, there are 2 types, qualitative research and quantitative research. Qualitative research is research related to qualitative phenomena like feeling, opinion or perceptions. And quantitative research, it is the research in which the observations are expressed in quantity, amount, figures or numbers. So these are all the types of research. Now we are moving to our next point, our important top point of this presentation, that is steps in research. So there are 7 steps in research process, right? So first one is identification of problem. Then second step is reviewing of literature, setting objective and formulating hypothesis. The next one is choosing appropriate study design and sampling methods. Then data collection, data analysis and interpretation of results. And last step is publication of scientific writing. So we'll see one by one. So first is identification of problem. So identification of problem means what it is that you really want to find out is your research problem. Means on which particular topic or which particular health issue or which particular disease of interest you want to study is your research problem. Okay. Then refining the problem. Refining the problem is simply converting a research problem into research question. Okay. That is why it is written identification of problem is research question. So it is nothing but from participants, please mute your mics. It is nothing but from problem or topic of interest coming to the questions that the researcher want to address. So research question presents an idea that is to be examined in the study. So if one wants a correct answer, she must ask a correct question. So framing a correct research question is very important. So it is because it is the starting point of the research. Getting the right answer to the wrong question is going to waste a lot of time and all the resources. So one must be very careful while framing this research question. However, the main problem is not asking the wrong question, but not properly defining the right question. So we'll see in next slide how we can define the right question. So good research question should pass the so what test. So the research question should have the Finer's criteria. We'll see one by one. F means feasible. So research question should be feasible in terms of time, then manpower, that means technical expertise, adequate number of participants, that is sample size, then resources like funds, material, equipment, etc. So it should be feasible. This all categories.
Just a moment, sir. Dr. Kazi, sir, please go on mute.
प्रीवियस की बात करके नया बना दो. आपने अभी वर्क नहीं किया ना, डिस्कस करना.
I means innovative or interesting. It should be interesting to the investigator. Then N means novel. Novel means what? It should confirm or refute or extend previous findings and then provides a new information or findings. Then it must be ethical, amenable to a study following ethical guidelines. Then R for relevance. So it should be relevance in terms of existing scientific knowledge. Then it improves clinical understanding or practice. It influences the health policy and it guides further research direction. Then S for social utility. So it should be into the benefit of the society. Then improves quality life of humans and it provides no harm to the environment. So good research question in this manner should pass the SWOT test or Finer's criteria, right? The next step is reviewing of literature. So before we see what is mean by literature review or review of literature, we will see these 3 confusing terms. First term is literature search. It means finding, reading, thinking and critically analyzing the literature material or all published material is called literature search. Then what is literature review or review of literature? It is writing literature search material in a systematic way. Okay. And the third one is literary research. There is it has nothing to do with this review of literature. Actually, literature review is a part of literary research, but literary research is not connected with reviewing of literature. So literary research, we already saw in previous slide, the meaning of literary research is critical or theoretical research work on basic principles or classical textbook, etc. Right? So what is literature review or review of literature? It is systematic, thorough search of all types of published literature in order to identify a breadth of good quality references relevant to specific topic. And why we do the literature review? It saves yourself from tedious work. Then to know the recent trend and studies in your particular area of interest, know the subject matter better or understanding the subject matter better, and it suggests new research topics, questions and methods. Which are the sources of this literature search? It is from classics like Samhitas, E-Samhitas, commentaries, Nigantus and Rasagranthas. Then previous theses and dissertations are also very important sources. Then journal websites for article of Ayurveda and biomedicine. E-resources means latest research updates from open databases like medical search engines of PubMed, Google Scholar, etc. Then well-known publisher websites like Elsevier, Scopus, Cochrane Library, etc. So these are the sources of literature review, literature search. Once you find the literature, then what? What to do with it? We have to write it in a organized way, organized manner. That is introduction, main body and conclusion. So this is reviewing of literature. Next step, third step is setting objectives and formulating hypothesis. So what is meant by aim? What investigator want to achieve is called aim, and how investigators are going to achieve the aim is called objective, right? So these are the steps how this goal is achieved. So it is called objective. So a well-worded objective should be SMART. So what is meant by S? Specific means the objective should be well defined, clear and unambiguous. It should be measurable with specific criteria that measures progress towards the accomplishment of the goal. Attainable, possible to achieve. Then it must be realistic, within reach and relevant. And T for time bound with clearly defined timeline, including starting and target date. So this is all about objectives. Then hypothesis. So what is meant by hypothesis? It is the statement or temporary statement or educated guess showing the relationship between two or more variables. So what is variable? So variable is characteristic being observed or measured. So it is dependent variable and independent variable. Dependent variable is the disease of your interest, and independent variable is drug under study. So hypothesis shows the relationship between the independent variable and dependent variable. Okay. So what are the characteristics of hypothesis? So it attempts to answer the research question. Then it can be formulated and tested, and it must be clearly stated and precise. Okay. So hypothesis is needed in the following study designs, like in all interventional studies, RCT, randomized controlled trials, then case control studies, cohort studies, and comparative cross-sectional studies. Moving to the next point, types of hypothesis. So there are two important types. Null hypothesis, it is also called statistical hypothesis. So it predicts that no relationship exists between the variables. For example, lower level of exercise, it is independent variable during the postpartum is not associated with greater weight retention, that is dependent variable. Weight retention is dependent variable and level of exercise is independent variable. So what null hypothesis says, it predicts that there is no relationship between the two variables. So that is why it is written is not associated. Then second is research hypothesis, or also called alternative hypothesis. So it states the expected relationship between the two variables. Same example, lower level of exercise during postpartum is significantly associated with greater weight retention. So what we saw, it states the expected relationship. And what is our expected? There is significant association between these two variables. So research hypothesis states the expected relationship. Okay. So this is the difference between the null hypothesis and research hypothesis. So due to time constraint, we cannot cover the other types of hypothesis, that is simple and complex, and directional and non-directional. So moving to the next slide. So this hypothesis can be summarized by the acronym PICOT. So well, hypothesis should cover, or it should have all these components in its statement. P for patient, population, or problem. So what is the patient group or population of people who are relevant to the area one or researcher need to look into? So it should be included in the hypothesis, patient, population, or problem. Then I for intervention or exposure. What intervention means? Independent variable, remedy or treatment, or medication. Do one want to investigate should also be included in the hypothesis. Then if there is a C for comparison group, it also must be included. So are there comparisons? That is control group. It may be a placebo, or it may be any standard treatment to be made. Differences to establish, it should be also be included in the hypothesis. O for outcome. So what are the relevant outcomes is also called dependent variables. So it may be a recovery, cure, or improvement in the consistency, then elevation, reduction, decrease, or relief in symptoms, or frequency of symptoms, then prevention of condition, then improvement in physical or mental health, or it may be morbidity or complication, or even death also in some situations or some conditions. And T for time. So appropriate follow-up time to assess the outcome should also be included in the well-worded hypothesis. Right. So this is all about the third step. And fourth step is choosing appropriate study design and sampling method. So what is meant by study design? A study design is a specific plan or a protocol for conducting the study which allows the investigator to translate the conceptual hypothesis into an operational one. The study design simply is a plan or protocol for conducting the study. So it has two main types: observational and experimental. Observation is non-interventional and experimental means interventional. Observational studies have again two types. First one is descriptive, means there is no comparative groups are there, and the types are case report, then case series, cross-sectional studies, and longitudinal studies. And second type is analytical studies, which have a comparative groups or comparison groups, or comparison is there. First type is case control study, which is retrospective in nature, and it gives the prevalence of the disease. And second type is cohort studies. It is prospective in nature, and it gives the incidence or probability of the disease of interest or occurring. Right. Then experimental studies have again two types. First one is randomized controlled trials, or RCTs, also called golden studies of clinical trials. And second one is non-randomized trials, or NRT, like uncontrolled trials, which has no control groups, then natural experiments, and before and after comparison studies are included in non-randomized trials. Observational studies means where the researcher studies but does not alter what occurs. Okay, these are called observational studies because there is no intervention here. Then descriptive studies, researcher examines the pattern of the disease. And in analytical studies, studies of suspected cause of the disease. Okay, is called analytical studies, case control and cohort studies. Then experimental studies, where the researcher intervenes to change the reality and then observes what happens, and compare the treatment modalities under the experimental studies. Then next is sampling method. What is meant by sampling? Sampling, the process of selecting a small number of elements, that is called sample, from a larger defined target groups of elements, that is population, such that the information gathered from the small group will be precise, accurate, and generalizable to the larger group. So sampling is simply the process of selecting samples from the populations. Here in this image which is placed here, you can see we are doing the sampling from the population larger group of people to the smaller group of people. Okay. So types of sampling, there are two main types of sampling: probability sampling and non-probability sampling. In probability sampling means all participants have equal chance of getting selected in the study. So types of probability sampling are simple random sampling, then systematic sampling, stratified sampling, cluster sampling, and multi-stage sampling, and one more type is there, multi-phase sampling. Okay. And second type is non-probability sampling, means probability of being selected is unknown. Okay. So types of non-probability samplings are convenience sampling, then quota sampling, judgment or purposive sampling, and snowball sampling. Right. So one must be very careful while selecting the sampling procedure or sampling method for their studies. The next step is data collection. What is meant by data? It is any sort of information that can be collected, recorded, and analyzed is called data. Which are the methods of collection of data? It may be in the form of subjective or objective criteria. So simple observation, then measurement, that is history taking and physical examination, or laboratorial, sonological, or radiological investigations. Then questionnaire, in-depth interview, personal interview, or focus group discussions are there. And experiments like in vivo means animal studies, in vitro means laboratorial studies, in ovo means studies of vaccines in chicks or embryos, and then in silico studies means studies which are conducted on the support with computers, and computer assisted studies are called in silico studies. So these are some methods of collection of data. Then what are the data collection tools? Also called study instruments. So for laboratorial tests or sonological or radiological investigation, specific instruments are there. It may be from simple weighing machine to MRI machines. Okay. Then for clinical diagnosis, there are case record form, CRF. For qualitative data, there are different types of questionnaires. Okay. So this is how we collect the data. The next sixth step of research process is data analysis and interpretation of result. So what is meant by data analysis? So we perform the we analyze the data by various statistical tests by using different softwares like SPSS, EPI Info, GraphPad, Microsoft Excel, etc. Here the raw data is converted into process data, and process data is finally converted into applied by final statistics. And this is how we analyze the data in two ways, mainly two ways: descriptive statistics and inferential statistics. So descriptive statistics refers to the various statistical measures that are used to describe the various characteristics of data. Like it may be in the form of mean, arithmetic mean, mode, median, standard deviation, standard error of mean, also called SEM, etc. Then inferential statistics, it refers to the various statistical measures that are used to draw some valid conclusions and findings. So we'll see in next slide the examples of inferential statistics. So in this table, you can clearly differentiate the parametric test and non-parametric test are applied for inferential statistics. Where the variable follows the normal distribution, we use parametric test, and where the variable are distribution free, we use non-parametric test. So to compare the dependent group, we use paired t-test. Here you can see the before treatment and after treatment, the individual is same. And the alternate to paired t-test in non-parametric test is Wilcoxon side rank sum test. Then to compare the individual group, we use unpaired t-test, and the alternate of unpaired t-test in non-parametric test is Mann-Whitney U-test. Then repeated measure ANOVA is the extension of paired t-test, where we compare one group with more than one control group on repeated occasions. One group on repeated occasions, like here you can see the first observation was done on 0th week, then 6th, 12th and 18th week observations are recorded. And the alternate to repeated measure ANOVA in non-parametric is Friedman ANOVA. Then one-way ANOVA is extension of unpaired t-test. Here we can compare the control group with more than one study groups or experimental groups. Here you can see one control group is compared with 3 groups. Alternate to one-way ANOVA in one-way ANOVA in non-parametric test is Kruskal-Wallis ANOVA. And for association studies or correlational studies, in parametric test we use Pearson correlation, and in non-parametric test we use Spearman correlation. So this is how we analyze the data. Next point in 6th step, that is data analysis and interpretation of result. What is the sequence of interpretation of result? So it must be start from most important or first result, then other result in specific order, then least important or last result should be noted in last point or last section of the result. The time limitation, we cannot cover all the points, so here we show some important points to be covered in interpretation of results. So first one is conceptual reasoning must be given for most important, other and least important results. Then the result must be compared and interpreted with previous work done and new findings with proper justification. Then results must be interpreted as compared to clinical and statistical significance. Then one must give the generalizability of the results, whether the results obtained from the samples are generalizable to the population.
Meditation.
The group analysis means the results which have been according to the age group or according to the gender. It must be substantiated. Proper justification. And last one is unexpected findings, negative findings should also be included, and novel findings should also be included with logical interpretation in this section. And the last step of this research process is publication of scientific writing. Imagine what would have happened in the world if no one had ever published their research. So without publication, science is dead. They are pale. So scientific writing or publication is very important after your work has been completed. So what is the basic structure of research paper? It is IMRAT. So I for introduction, the M for materials and methods, then result, and then discussion. So it is the main body, IMRAT is the main body, but title, abstract and conclusion and references also should be included in this scientific writing. What is introduction? Why did you start this introduction? Then what is meant by methods? What did you do? It should be covered in methods. Then what did you find? It should be covered in results. What does this mean? It should be
पाठवायचं नाही असं म्हणलं का कधी पाठवा लगेच पुण्याला गिनोडे सर अनम्यूट करा माईक तुमचा. आदिती मॅम अनम्यूट करा अतुल सर.
येस सर. येस.
मी तर काहीच नाव विचारलं नाही, डायरेक्ट जॉईन झालोय मी. डॉक्टर कवितामुळे परत नाव आलं.
आदिती मॅम अनम्यूट करा अतुल सरांना.
सर मी करतेय, पण ते को-होस्ट असल्यामुळे ते स्वतःच करू शकतात. माझ्याकडनं त्यांना मेसेज जातोय अनम्यूट करा म्हणून.
करताय बहुतेक मेसेज गेलाय तर.
येस सर.
गिनोडे सर कंटिन्यू करा.
Yes, yes, sir. Yes.
Yeah, you was unmute for short while.
Okay, okay. Sir, कुठून होतो मी अनम्यूट?
This last slide.
Last slide.
7th का? हे sir.
Yes, sir.
Yeah.
Yes, yes. Okay. So this is the last step, that is publication or scientific writing. So imagine what would have happened in the world if no one had ever published their research. Without publication, science is dead, by Gerard Pell. So basic structure of research paper is IMRAT. So it is introduction, materials and methods, results and discussion. But though it is a main body, the title and abstract and conclusion and references are also added in this section. So introduction, why did you start? It covers in introduction section. Then what did you do? It should be covered in materials and methods section. What did you find? It should be covered in results section. And what does this mean? It should be covered in or discussed in discussion section. So there is one letter from Ministry of Ayush, Government of India, which is given on 2021, that the scholars of all Ayurveda field should publish their research in UGC listed journals. So I gave here some the journals of which are listed in UGC care list. That is Annals of Ayurveda Medicine, AAM, which is published from Lucknow. Then Journal of Ayurveda, which is published from National Institute of Ayurveda, Jaipur, Rajasthan. Then JM, Journal of Ayurveda and Integrative Medicine, which is published from University of Pune. AYU, which is published from IPGT and RA, Jamnagar, Gujarat. Then Journal of Ayurveda Case Reports, which is published from All India Institute of Ayurveda, New Delhi. Then there are two journals which are published from Central Council of Research in Ayurveda and Siddha, that is CCRAS, and one journal is published from Hyderabad, that is IJAM. So these are the UGC listed journals where one can publish their articles or their papers. Okay. So takeaway message: spending time for scientific, that is systematic, stepwise research is buying an insurance policy for a healthy future. So once again, I would like to thank the organizing committee members for giving me this opportunity to present this topic on this platform. Thank you once again. Over to you, madam. Thank you.
Thank you, sir. You have enlightened to us about the subject. Now I invite our chairman, Honorable Deepak Sawant sir, for his expert comments. Deepak Sawan, sir.
Sir, am I audible, sir?
Yes, sir.
Yeah.
Good morning, sir. Good morning. Good morning, all. I am very much thankful to all the host, coordinator, director of AYUSH, Ministry of AYUSH, mostly Dr. Datta Patil sir, Khatti sir, Battane sir, that give me opportunity to be a chairperson of a session. In this session, Dr. Ginode sir, he is well-known faculty for the research in Ayurveda and all the research activities. Actually, he very much clearly express about the steps in research, and he one by one steps, that is identification of problem, reading of literature, setting objective and formulation of hypotheses, choosing appropriate study design and sampling method, data collection, data analysis, publication of scientific writing. All the steps are very, very simplified by the Ginode sir, and which are very much useful to all the faculties, PG students, new upcoming researchers, who are working in the field of Ayurveda. That is very much important to all the PGs who are working in all the PG department and various institutes in whole India. So it is a very, very much fruitful lecture given by the Ginode sir for the all faculties and all the institutes and all the our Ayurveda faculty. So thanking of you. Thank you, sir. Thank you, sir.
Thank you. Thank you, sir. Thank you for your expert comments. Next, I invite co-chairman Honorable Vaidya Raghavendra sir, Kolchi sir, for vote of thanks.
Good morning, sir. Am I audible now?
Yes, sir.
Good morning, sir.
Good morning.
So, on occasion of Azadi Ka Amrit Mahotsav, 75th anniversary of Independence of India, I will first of all thankful to Directorate of AYUSH, Government of Maharashtra, and Maharashtra University of Health Sciences, Nashik, and Maharashtra Council of Indian Medicine, as well as B.R. Harne College, and for hosting this. And I will first of all thank to Principal Dr. Sampath Bhatne sir, and Chairman Honorable Dr. Deepak sir, and Dattatreya Patil sir. I am very thankful to those people. Without that, it is not possible to conduct. And coordinator Dr. Pankaj Shetty sir, and Honorable Speaker Dr. Atul Ginode for his useful speech on research methodology and biostatics in the field of Ayurveda, which is very useful for PhD candidates and PG students, and even for lecturers and those who are in the field of research in the Ayurvedic section. So this speech was very much informative. For that one, once I'm thankful to Dr. Atul Ginode sir. And lastly, I am thankful to all the people who are directly and indirectly helping to conduct as well as success of this event. Thank you. Thank you, one and all.
Thank you, sir. Now for further session, I invite second topic coordinator, Honorable Vaidya Jayant Kharar sir.
Thank you. Thank you very much, sir. Am I audible?
Yes, sir. You are audible.
Yes, sir. Yeah.
Okay. Thank you. Today, good morning to all of you. Today, there is organizing one webinar series of Department of Shalakyatantra by Association of Management of Ayurvedic Medical College, Government Aided Ayurvedic College, and Principal Association on the occasion of Azadi Ka Amrit Mahotsav. And I am Dr. Jayant Kharat, PG Coordinator and Associate Professor at Honorable Shri Anna Sahib Dange Ayurvedic Medical College, Postgraduate Training and Research Center, Ashta, coordinating this session. And this whole webinar on recent advances in Ayurvedic dentistry, endorsed by Director of AYUSH, MUHS Nashik and Maharashtra Council of Indian Medicine, Mumbai. Today's second session is on Ayurvedic dentistry, recent advances in Ayurvedic dentistry. This session is coordinated by me. Speaker of this session is my guide, my mentor, Dr. Chandrasekhar Mule sir. He is professor and HOD of the Yeshwant Ayurvedic College, Kodoli. Chairman of this session is Dr. Praveen Chavan sir, professor and HOD at LRP Ayurvedic Medical College, Islampur. Co-chairman of this session is Dr. Suvarna Golecha madam, and secretary of this session is Dr. Govind Shinde, professor and HOD at CSMSS Ayurved Mahavidyalaya, Aurangabad. First of all, I will wish to all of you for best wishes of Azadi Ka Amrit Mahotsav, and very warm welcome to all special invitees, speaker, chairman, co-chairman, secretary, and very most important, you all participant. Without wasting of time, I will do request to secretary of this session, Dr. Govind Shinde sir, for the introduction of today's guest speaker, Dr. Chandrasekhar Mule sir. Over to you, Dr. Shinde sir.
Good morning. Am I audible, sir?
Yes, sir.
Once again, good morning to all the dignitaries all over the Maharashtra. First of all, I must be thankful to the organizing team, particularly Sampath Bhattane sir, Datta Patil sir, and all other organizers for giving me this opportunity to participate in this online webinar, and giving special opportunity to be a chairman for this session. Again, it gives me immense pleasure to introduce today's speaker for the second session, that is Chandrasekhar Mule sir. He is our senior for UG and PG as well. He did his post-graduation from Government Ayurvedic College, Nanded. Presently, Mule sir is working as professor and HOD, Yeshwant Ayurvedic College, Kodoli, since last 20 years, means since 2001. Since 2001, he is guiding to UG and he is guiding to PG since 2006. That means he is having almost 15 years teaching experience for PG. Also, he is guiding to the PhD students since last 9 years, and he had published the more than 30 articles in national and international journals. So, the Mule sir, I know personally, he is a very enthusiastic person, and he is guiding consistent, innovative person in the field of Ayurveda. So I wish all the best to Mule sir. Thanking all the organizers. Over to Mule sir.
Thank you, Shinde sir. I will do request to Dr. Mule sir to give his valuable words on recent advances in Ayurvedic dentistry. Over to you, sir. Thank you.
Can I am audible?
Yes, sir.
Yes, sir.
Okay.
Please
yes.
Thanks to organizer and my friend Dr. Sampath Bhattane and principal Dr. Datta Patil sir, and today's session's chairman and my friend Dr. Praveen Chavan sir, Dr. Suvarna Golecha Madam, Dr. Govind Sinde, and all. I welcome all of you to today's lecture, that is research advantage in Ayurveda dentistry. Ayurvedic medicine was considered to be world's oldest and ancient system of traditional medicine, which of oriented in India thousands of years back. As concerned as Ayurvedic dentistry, it is described in chapter of Mukharoga, mainly Danta and Dantamulgat. These two parts are concerned to Ayurvedic dentistry. Tooth, it means Danta, and Dantamulgat, that is part of gingiva and periodontitis. These are mentioned in Bhratri and Lagutri. In Sushrut, Nidan Stan and Chikitsa Stan. In Charak Samhita, that is in Chikitsa Stan, in Vagbhat Uttar Stan, and also Ashtang Sangraha, 25th and 26th chapter is based for that particular Mukharogas. There was a long history regarding plants for the improvement of the dental health and oral hygiene. Ayurvedic medicine have been proven to be safe and effective to several hundred to several thousand of years. The exploration of botanicals used in traditional medicine may lead to the development of the novel preventive or therapeutic strategies for oral health. Almost of the oral diseases are due to bacterial infections, and it has been well documented that medicinal plants confer considerable antibacterial activity against various microorganisms, including bacteria responsible for dental caries. To study various plants and their products as effective medicines in the treatment of various ailments since ancient times, the dentists need to be more informed regarding the use, safety, and effectiveness of the various traditional medicines and over-the-counter products. As this hardly explored part of the field of dentistry, there is a need for integration of professional dental treatment and modalities and complementary alternative medical system to provide the best of unique from the system of the patients as a complementary therapy and alternative choice of the treatment. And considering the importance of Ayurveda and various traditional systems in my today's lecture, the present scientific evidence-based review of literature is focused on the possible role of the Ayurveda in the management of various orofacial disorders from recent publication and recent articles, etc. According to the Shalakyatantra, we know 65 diseases and 15 of the alveolar region and 8 concerned teeth. And periodontal disease. This is the list of the 15 periodontal diseases. Out of that, only virgin disease are not included because the extra tooth are generated in this disease. Okay, and like this, dental diseases, Krumidanta Dalam, in that list, another disease that is Hanumoksha. It is included, but not real dental diseases. For the treatment of this disease, Ayurveda advocates procedures such as oral cleansing, extraction, excision, flap surgeries, etc. Along with the treatment of oropharyngeal diseases, Ayurveda recommends some of daily use of therapeutic procedures for the prevention and the maintenance of the oral health. This includes Danta Dhavan, then juval irlekan, gandusha, that is gargling or oil pulling, and tissue regeneration. That 4 procedures are very important. The first procedure is Dantadhavan. Animals never clean their teeth. Probably men in ancient time also never clean this teeth, as this food contain lot of hard, rough substance. Each tooth, the cooked sticking, the dental service serves as a good medium for the bacterial growth. Therefore, this is essential to clean and brush the teeth in the morning after getting up. For that matter, each tooth should be brushed individually by the kurcha, that is a stick of the various plant. The toothbrush should be rotated over the gums and the teeth in vertical manner, that is from below upward in lower jaw, below to upward, and from above to downward in the lower jaw. Side to side brushing should be avoided, as it may damage necks of the teeth and also the gums. One should gargle the mouth after the brushing the teeth as well as after eating any food. Ayurveda recommend chewing sticks in the morning as well as after the meal to prevent the diseases. Ayurveda insists on the use of herbal brush approximately 9 inches long and the thickness of the little finger. This herb stick should be either kashai, katu, or tiktaras. The method of the use of the to crush one end and chew it, and chew it is slowly. The neem is famous herbal chewing stick. Fresh stream of Yaste Madhu, Khadir, Arjun tree, Karanch, and Ark. Apart from Shleshmantak, Arishtak, Bibitak, can also be used for brushing. This is the brushing. About the recommends chewing sticks in the morning as well as after every meal to prevent diseases. Ayurveda insists of the herbal brush approximately 9 inches long. Okay, and chewing on the stems is below to the cause attrition and leaving biting surfaces. Hello, can I am audible till?
Yes, sir. Yes, sir. You can continue.
Okay. What is the advantage of the toothbrushing? Brushing removes food particle, the extraction, tartar on the neck of the teeth, and mucoid secretions collected in the mouth and tongue over the night. It cleans the teeth and mouth, and the person feel fresh and appreciate the taste of food in the better way. The mind is also refresh that procedure. In some diseases, status brushing the teeth with steam or tree is contraindicated. like bleeding disorders and edema, just like constipation, indigestion. And another procedure is a Juhar Nirlekhan, tongue scraping. It is ideal to use gold, silver, copper, stainless steel for the scraping of the tongue. Tongue scraping stimulates the reflex point of the tongue and it removes bad odor. Secretion of the digestive enzymes that stimulate and remove malicious of bacteria growth. Approximately over 500 varieties are present in mouth buccal cavity. The clinical evidence also shows that use of tongue scrap on the regular basis has a significant and destroys bad odor. Third procedure is a oil pulling, that is a gandush. Kaval gandush and ancient natural healing procedure to maintain the basic patient care, and for this preventive dentistry remain a foundation of oral health care. This gandush is prevent decay, bleeding gum, dryness of throat, and also strength, improve the strength of teeth, gums, and the jaws. This oil pulling therapy can be done using oil like sesame oil, that is steel tail. But in our India, sesame oil and coconut oil is freely available to this gandush procedure. Four types of gandush, that is a snehik, sleshmik, or shodhanik, and ropnik gandush. This contraindication, gargling at the contraindicated in unconscious poison patient, weak marasmus patient. The procedure it can be modified. It is the act of simply holding comfortable quantity, that is 10 to 20 ml of oil, and include the quath remaining, or only 10 ml to 20 ml oil can sufficient for this procedure. Coconut oil and sesame oil are easily available. It can be take for gandush, or siddha oil, that is irimidadi tail. It is very best for all mukharogas. Root of sesame is contain antifungal activity, antimicrobial activity, and anti-inflammatory properties. The mechanism of action of oil pulling, that is gandush, is forming antioxidant, and which disturb the cell wall of the microorganisms and thereby killing them. The oil leads to attraction of the bacterial cell membrane, and which cause to stick the get pulled towards the oil. The oil gas lubricates the entire oral cavity and also limits the aggravation of the bacteria and formation of the plaque. This leads to better gingival periodontal health and decrease in dental decay, eliminating bad odor from the oral cavity, various studies shows the beneficial effect of the this Gundus procedure. 20% of reduction in bacteria count after sesame oil pulling. Equal effectiveness of the sesame oil pulling was seen as compared to chlorohexane mouthwash, and equal effectiveness of the oil pulling elements malodor also be seen. Another procedure is a tissue regeneration therapy. Well-known drug, that is amlatiki, is a considerable general building of the oral health. Amla works well as mouth rice as a decoction. 1 of 2 grams per day can be taken orally in capsule form. It is a modified procedure for long-term benefit to the teeth and gum. This amla supports the healing and development of the connective tissue when taken internally. Regular use of berry that fruit stabilize collagen and strength of the tissue, gum tissue. Ayurvedic herbs with various oral health related properties. Danta, all orofacial diseases, various clinically implementation, this compulsory use Ayurvedic herbs and the management of the oropharyngeal diseases. This data were performed in PubMed Central Library, Dentistry, Herbal Medicine, Periodontitis. A total of 145 relevant articles are available, followed by the case report. Various studies have mentioned the uses of herbs which are founded to be statistically significant in the treatment and management of the oral and dental diseases. Current research shows that herbal extracts are effective because of the interaction with the specific chemical receptors within the body. Nowadays, there has been sudden increase in use of herbal extraction or the plant product as an alternative approach to modern day medicine. Still, India has enormous resources of herbal medicines, and that herbal medicines have been used for many years, but its application in dentistry had not been explored fully. If this happens successfully, India could gain significant competitively is the global market, especially in the cosmetic medicines and orodental remedies. In that field, China medicine use about 5,000 plant and their species, but our India more than 700 species are we use, but still not well established in the international market. When compared to the Indian market, the reputation of the Indian herbal medicine market, that is around $1 billion worldwide. as against of the global market, that China medicine is 19 billion. See the difference of the both herbal remedies. The major problem in acceptability of Ayurveda and its products, it is a lack of proper standardization technique and unproperness to accept global challenge. Ayurveda need immediate and extensive reorientation to gain readability. Hence, researchers should be encouraged to conduct more studies to prove the effectiveness and safety of natural dental product. Another topic is point is diet and healthy teeth of the gums. In dietary, milk and milk product, that is ghee, fruit like mango, amlaki, banana, coconut, sugar cane, honey products. These all products may include in daily our diet. The use of herbal medicine has been successfully applied in dentistry as an antiseptic, antioxidant, and analgesic. The natural herb drugs play an alternative role to antibiotics and also aid in the healing of the infections and thereby improving immunity. However, controlled clinical trials are required to validate the use of the traditional therapeutic strategy in the dental field. Oral diseases are one of the most important problems in the public health and are the rise developing countries. Most of the oral diseases are caused due to the bacterial infection. The antibacterial activity of the medicinal plants are due to the presence potential bioactive compound which help the reduce bacterial load in the oral cavity and thus prevent the formation of the dental plaque, dental caries, and ulcers. The use of indigenous plant in oral health and hygiene has a long history. In different plant of the different part of the world. Therefore, this knowledge is likely to vanish as soon as many of the psychotherapeutics remedies are followed only by the few in the rural areas. The new generation is ignorant of the traditional knowledge because of the younger generation lack of the knowledge of the identification of the plant, collection of the plant, and preservation and processing of the species for the medicinal use. It is therefore very crucial to conserve this cultural practice before they are lost definitely. In this paper, an attempt has been made to review various herbal plants mentioned in Ayurveda that can be used an adjunct for the maintenance of the oral health. The literature shows that there are numerous Ayurvedic drugs which can be used prevention as well as management of the oral diseases. Many Ayurvedic herbal plants which are reviewed, process, micro bacterial and anti-inflammatory, analgesic, anti-ulcer activities according to the modern parameters. However, among them, very negligible amount of the herb extract are used in clinical practice, and the rest of the other are not practiced because of their unknown toxicological effect. The clinical studies should be encouraged to the assess of the effectiveness as well as the toxicity of the herbal drugs. The traditional knowledge of the Ayurveda should be integrated with the modern dentistry. That is the need, and for this, the active principle of the plant should be incorporated into the modern oral healthcare practice, and dentistry should be encouraged to use natural remedies and in various oral health and treatment. This will make dentistry much safer and affordable and more accessible for the low socio-economical group in the society. Thank you. Thank you very much.
Thank you. Thank you very much, sir. Thank you very much for your valuable words on Ayurvedic dentistry. And I will do request to Dr. Praveen Sawan sir for giving his concluding remark about the importance of this topic. Over to you, Praveen Sawan sir.
Good morning, all of you. I am very much thankful to all host, co-host, coordinator, Ayush Ministry, Sir Dr. Datta Patil sir, Dr. Sampath Bhattani sir, for giving me opportunity as a chairperson of this session at the occasion of Azadi Ka Amrit Mahotsav. Dr. Mule sir had explained all topics very well with Ayurvedic concepts and modern concepts. Sir given too much examples in his lecture to simplify the topic, explaining Kavalgandush in very well manner. This is very helpful for the Shalakis. Diet and teeth, oral hygiene is also very well explained. Sir is my PhD guide. He is giving prompt and vigorous reply of any queries. All you know. This topic, recent advances in Ayurvedic dentistry, is very much helpful for UG students, PhD students, all teachers, all Shalakis. Thank you, sir. I am requesting Dr. Jayavant Kharat sir to coordinate further session.
Thank you, sir. Thank you very much. Now I will do request to co-chairman of this session, Dr. Suvarna Golecha ma'am, for giving vote of thanks for this session. Over to you, Dr. Golecha ma'am. Golecha ma'am, please unmute yourself. Yes, ma'am.
Hello.
Yes, ma'am. You are audible.
Yes, good morning, everybody. Very nice lecture delivered by Dr. Chandrasekhar sir. Very inspiring for the new PG students. We are very thankful to the lecturer sir, Dr. Mule sir. And basically, we are very thankful to Chairman Dr. Praveen sir and all the organizer and host team. Thank you, sir.
Thank you, madam. Now, today's second session is over. On behalf of me and all organizers, I am very much thankful to Dr. Datta Patil sir and Dr. Sampath Bhattani sir for giving me this opportunity. And thank you very much. I will hand over this coordination work to Dr. Chandrakant Gosavi sir for next session. Thank you all.
Thank you, Mulay sir, for wonderful lecture.
Thank you all, Shalaki.
Thank you. Thank you. Chandrakant Gosavi sir. Yes, sir. Thank you.
Very nice lecture, sir.
Thank you, sir.
Hello. DMA मारित. DMA मारित.
Hello. हाँ Gosavi sir.
Yes. Hello.
गोसावी सर कंटिन्यू करा. आपला आवाज येतोय.
sir.
Yeah, you are audible. We are getting you.
Yes. Good morning to all of you. And
Hello.
Thanks to Dr. Batane sir and Patil sir for organizing this seminar, Azadi Ka Amrit Mahotsav 75th anniversary of independence of India. This is the third session. And the topic is recent advances in Ayurveda ophthalmology. Speaker is Honorable Dr. Kirke sir, Chairman Jayant Wag sir, Co-Chairman Nutan Madam, and Secretary Sunil sir, Coordinator myself Dr. Chandrakant Gosavi, Associate Professor, DSBT Ayurvedic College, Waguli. Now I will hand over this part to Dr. Sunil sir. He is giving introduction of honorary speaker, Dr. Kirke. Okay.
Hello, good morning everyone. Am I audible to you?
Yes, sir.
Yes, sir. Bola.
Good morning everyone. I welcome as the secretary of this session everybody. Speaker, introduce them. He is a native of Gam. He completed India graduation from Ocular College, Pune in 1997, respectively. Presently, he is HOD professor, PG. PhD guide in इगतपुरी.
नेट गेले बरं का त्याला फोन कर काय झालं म्हणून तुमचं.
डॉक्टर वालेवाडीकर, डॉक्टर सुनील वालेवाडीकर, तुमचं नेट कनेक्टिव्हिटी पुअर आहे. नेट कनेक्टिव्हिटी पुअर आहे. तो आवाज येत नाही आपला. थोडस रेंज मध्ये बघा ना.
आता येतो का सर?
येस 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 राईट.
So he is a BOS member for the Ayurveda University Nagpur, and he is a member of BOS the DY Patil Pune. Sir, आवाज येतोय ना व्यवस्थित?
Yes, sir.
Okay. He is a PG examiner panel for the out of Maharashtra in Kerala and Karnataka. Other than the academics, he worked as assistant convener, district secretariat for the Rotary Club Jalgaon. About his clinical ophthalmology knowledge, he has performed more than 600 eye checkup camps and more than 1,500 free cataract surgery. He is a well-known phacosurgeon.
Not audible, sir.
He is a well-known phacosurgeon. He performs the cataract, the dacrocystitis, squint surgeries in his own clinic. He is also a social worker. He received a community ophthalmology award in Sri Lanka in international. He received in the Rotary class. About his life partner, Dr. Kajal Firke. She is associate professor and PG guide in SMBT IB College, Igatpuri. Now, as the rainy season, Shravan is going on. The rain is showering. In the same way, Dr. Tushar Firke sir will shower his experienced knowledge in ophthalmology about the advances, recent advances in Ayurveda ophthalmology. So I request Dr. Tushar Firke sir, he will deliver his speech. Thank you.
Hello, I am audible?
Yes,
yes. स्पीच स्टार्ट करने से पहले भगवान धन्वंतरी को मैं नमन करते हुए आगे जाना चाहता हूँ। ओम श्री धन्वंतराय नमः। The respected dignitaries, Dean of our faculty, Dr. Srikant Deshmukh sir, Dr. Sampath Bhatane sir, Dr. Datta Patil sir, the chief advisors, patrons, the Association of Management of Ayurvedic Medical Colleges of Maharashtra, the members of NIMA Association, the members of Vishwa Ayurved Parishad, Ayurved Vyaspeeth, Akhil Bharatiya Ayurved Sammelan, National Ayurved Student and Youth Association, BMS Graduate Association of Maharashtra and Astitva Parishad, the chairman, co-chairman, secretary, coordinator of today's this session, and all the participants of this webinar, and my fellow Shalakyas. A very good morning to you all and happy Friendship Day. Today's my topic is the recent advances in Ayurveda ophthalmology. I request Dr. Faisal to share the PPT. Dr. Faisal. Hello.
Hello.
Hello. Next slide, please. Next, sir. The introduction of our today's subject is there is a tremendous advancements made in the science of ophthalmology in recent year has opened a new era in the history of medicine. आप सब लोगों को पता है कि ऑप्थेल्मोलॉजी का जो साइंस है वो बहुत आगे गया है। फेको आ गया है, लेजर्स आ गए हैं, ओसीटी आए हैं, बहुत सारी चीजें अभी ये रिसेंट ईयर्स में अभी डेवलप हो गई है। But at the same time, there are a lots of challenging problems existing before modern ophthalmologists that require special attention to develop the tactless field of medical knowledge hidden in the ancient medical text. अभी अपने को ये सब इतना एडवांस होने के बाद भी अपने सामने बहुत सारे प्रॉब्लम्स है कि जो अपन टैकल नहीं कर सकते। नेक्स्ट स्लाइड प्लीज। फॉर एग्जाम्पल अभी कौन कौन से प्रॉब्लम अपने सामने है। फर्स्ट वन इज रेटिनाइटिस पिगमेंटोसा, सेकेंड वन इज ग्लाकोमा, थर्ड वन इज ड्राई आई सिंड्रोम, देन डायबिटिक रेटिनोपैथी, देन एलर्जिक कंजंक्टिविटिस, एज रिलेटेड मैक्युलर डिजेनरेशन, देन मायोपिया है। ऐसे बहुत सारे प्रॉब्लम्स है। These all problems have remained unsolved since decades. So we have to search the solution on this problem. Next slide, please. Then what next? Need of alternative therapies. When there is no allopathy is successful in these diseases, due to the difficulty mentioned above, it is the time that the need for such a drug we could effectively tackle all the problems. अभी ये सर्च करते करते जहां एलोपैथी नहीं काम कर रही फिर दूसरे पैथी के लिए अपने सर्च करना चाहिए। फिर आगे आता है क्या? नेक्स्ट स्लाइड प्लीज। आयुर्वेद क्या कहता है? सर्वेंद्रियाणाम नयनम प्रधानम, सब इंद्रियों में से जो है नयन ये सबसे इंपॉर्टेंट ऑर्गन है। नेक्स्ट स्लाइड प्लीज। Then what is the role of Ayurveda and scope? A wide number of indigenous drugs combined with untold claim of their diverse uses in alleviating wide range of ophthalmic affections, called for scientific validation for their attribute and principles. ऐसे बहुत सारे स्वदेशी ड्रग्स है कि जो अपने ऑप्थेल्मिक जो डिसीजेस है उनके उपशमनार्थ अपन यूज करते हैं. In Ayurveda literatures, record more than 50 ophthalmic plant drugs and more than 40 metal minerals having diversified pharmacological actions on visual system and adnexes of. आयुर्वेदिक लिटरेचर में 50 से भी ज्यादा और 40 से ज्यादा मेटल्स मिनरल्स जो है उसका जो एक्शन है वो आंख पे बहुत अच्छा है. नेक्स्ट स्लाइड प्लीज. अभी आयुर्वेद में आप क्या कर सकते हैं? आप हाउ टू प्रिपेयर न्यू ऑप्थेल्मिक ड्रग्स, आयुर्वेदिक ड्रग्स. तो फर्स्ट वी हैव टू स्क्रीनिंग विथ रेफरेंस टू फार्माकोलॉजिकल एक्शन. ड्रग जो है वो फार्माकोलॉजिकल एक्शन के हिसाब से अपने को स्क्रीन करना चाहिए कि अपने को एक डिसीज है उसमें कौन सा ड्रग काम कर रहा है और वो कौन से माध्यम से अपने को यूज करना है. देन सेकेंड वन इज मॉडिफिकेशन ऑफ ड्रग, कि वो ड्रग अपने को मॉडिफाई कैसे करना है. नेक्स्ट स्लाइड प्लीज. स्क्रीनिंग कैसा है? स्क्रीनिंग में एग्जांपल बताता है कि समझो अपन एक चक्षुष ड्रग ले रहे हैं. चक्षुष improves vision and various disorders of vision. For example, पलाश, ब्यूटिया मोनोस्पर्मा. जो चक्षुष ड्रग है वो सिलेक्ट करने के. सेकंड, अपने सारे नेत्रशूल वाले भी पेशेंट अपने पास रहते हैं तो नेत्रशूल और यानी एनाल्जेसिक ऑप्थेल्मिक ड्रग्स, फॉर एग्जांपल रुबिया पॉर्डिफोलिया. Then नेत्र कंडुहरा, that is anti-allergic drugs, that is Berberis aristata. तो ये हिसाब से अपने को चक्षुष, नेत्रशूलहर, नेत्र कंडुहर, ये ऐसे ड्रग अपने को पहले चॉइस करना चाहिए. नेक्स्ट स्लाइड प्लीज. अभी इसका मॉडिफिकेशन कैसा करना है? तो इसका मीडिया चेंज करेंगे. फॉर एग्जाम्पल Berberis aristata. A clinical study was conducted to evaluate the effect of ghee prepared with haridra and daru haridra in diagnosed case of dry eye syndrome. haridra and daru haridra का जो ड्राई आई पे क्या इफेक्ट होता है, एक क्लिनिकल स्टडी अभी हुआ है. The results are encouraged and the घृता from drug is clinically effective than that of decoction form of the same drug as mentioned in the class C. जो अपने ग्रंथ में लिखा है कि हरिद्रा दारू हरिद्रा का डिकॉक्शन जो काम करेगा लेकिन वो घृत के साथ अपन मिलाएंगे तो ज्यादा इफेक्टिव होता है. तो ये टाइप से अपने को मॉडिफिकेशन करना चाहिए. नेक्स्ट स्लाइड प्लीज. अभी फर्स्ट जो है, जो मैंने जो प्रॉब्लम्स बताए कि ऑप्थेमोलॉजिस्ट के सामने कौन कौन से प्रॉब्लम है. तो फर्स्ट वन इज रेटिनाइटिस पिगमेंटोसा. ऑल ऑफ यू नो दैट देयर इज नो ट्रीटमेंट of retinitis pigmentosa in modern than allopathy. Retinitis pigmentosa may be inherited as an autosomal dominant, autosomal recessive or X-linked disorder. In the presence of large pedigree, the recognition of X-linked or dominant transmission of the gene is straightforward. As in the disorder, the consanguinity of the parent may indicate autosomal recessive A inheritance. Retinitis pigmentosa is a hereditary disease. Okay, next slide, please. One slide is missing there. What we can do the treatment in Ayurveda for retinitis pigmentosa? I will just tell you in orally. In our SMBT college, we treated this patient with this treatment. I am telling you, Patoladi Grut for Tarpan for 7 days Tarpan. Then Jivantadi Grut for Nasya Karma for 7 days. This is the local treatment. There for internal use, again Patoladi Grut twice a day with milk. Then Punarnava juice 5 ml twice a day. Then combination of Tripada Churna through 250 gram, Yashada Basma 5 gram, Pravada Basma 5 gram, Guduchi Sattva 10 milligram. Ye all the churnas we have to mix this churnas and 5 gram twice a day in oral formation. We are treating this type of treatment in SMBT Ayurveda Mahavidyalaya. Then this slide is on the desktop. The observations. The patient was brought with the history of gradual loss of vision. रेटिनाइटिस पिगमेंटोसा का जो पेशेंट आता है वो ग्रेजुअल लॉस विजन लेके आता है एंड नाइट ब्लाइंडनेस. अब ये जो पेशेंट था इसका विजन एक्सेप्टेड बोथ आईज फर्स्टली व्हेन केम इट्स 6/12, देन डिटोरिएटेड 6/18, then deteriorated 6/36, then came on finger counting for half meter distance. The patient had taken the treatment for the same from different system of medicine. जो examination है fundoscopic, pale and waxy optic discs with blurred margin, attenuated arteries, small clumps of pigment scattered throughout the fundus. Patient would advise this treatment, just I have told you, patoladi growth, jivantadi growth, then oral treatment, then churna treatment for 4 months. Okay, here Tarpandi is given for 7 days, intermittent after 15 days for 3 months. Improvement of this patient is visual acuity 6/60 both eye and improvement of quality of night vision. Okay, next slide. What is the pharmacological base of all these drugs? The Amalaki, it is the Chakshusha drug that improves the vision. Then it's effective in the management of disorder of the vision. Haritaki jo hai, effective in the managing various disorders of eye, and it is also Chakshusha. Bibitaki, that is Netriya, conductive to visual system, it is also Chakshusha. Punarnava is for Nisandata, that is night blindness and Timira disorder. Yashada is working also as a Chakshusha drug. Then Pravada is also on the Timira disorder of vision. Then Guduchi, it is the Sarvaroghar, affecting in the managing disorder of the vision. Then Jivantadi growth, it is act on the Timira, that is disorder of the vision. And Patoladi growth acts on Timira and Naktandeta, that is night blindness. A pharmacological base के हिसाब से ये retinitis pigmentosa का treatment हो सकता है. Next slide please. Then again one ophthalmic disease, that is the headache to ophthalmologist. Chronic simple glaucoma. Chronic simple glaucoma is a major blinding condition in present area, occupying 1.79% of total blindness, causing gradual deterioration of the eyesight, characterized by optic disc cupping, visual field defects, elevated intraocular pressure to damage the eyesight. What is the aim of this statement here? Aim to reduce the intraocular pressure, include topical and systematic medication. Unfortunately, how many adverse effects that interfere with vision and eye in allopathy? Next slide, please. In modern system, what we are using for glaucoma, that is the parasympathomimetic agents, pilocarpine. But its side effect or adverse effect is blurred vision, visual problem due to constriction of pupil. Then sympathomimetic agents, that is adrenaline. Adrenaline का side effect है the precipitate closed angle glaucoma, dilatation of pupil, local irritation, and cardiovascular side effect. The next drug is topical agent, that is beta blocker, timolol-maleate. It is contraindicated in respiratory and cardiovascular disease. Then carbonic anhydrase inhibitor, acetozolamide, that is Dimox, etc. But its side effect is nausea, lassitude, paresthesia, and renal soul. So these are the many of the adverse effect in allopathy. Next slide, please. Then what Ayurveda can do for glaucoma? The glaucoma, you can use the Mahatripada growth for Tarpana. This is topical use, 20 ml for each eye, scheduled for 7 days. Then oral also Mahatripada growth, 5 ml BD with hot water before food for 1 month. Then decoction of Punarnava, orally 30 ml BD for 1 month. This treatment is advised for 6 month oral administration. Okay. And then follow up also taken intermittent between. Next slide, please. So this is the data of the patients day by day, 1, 2, 3, 4, 5. Next slide, please. What is the response of the Ayurvedic treatment of glaucoma? So this is the graphical presentation. Excellent 63.3, good 6.6, moderate 20, and no response 10. Then next slide, please. What is the parasurgical approach according to Ayurveda for glaucoma? That is the Shalakyatantra. Non-toxic leeches collected from freshwater sources and stored in clean fresh water in the glass jar and maintain them following textual direction. After taking the appropriate preoperative precaution, single or multiple leeches were applied at temporal area, outer canthus or bulbar conjunctiva accordingly. This is the graphical data of the Shalakyatantra, how to IOP reduces after the Shalaka. SMBT हमारे SMBT हॉस्पिटल में हम Shalakyatantra ही ज्यादा करते हैं. Next slide, please. Then the next disease is dry eye syndrome. This is also one of the headache for the ophthalmologist. In certain condition, there is insufficiency of lubrication of eye, and then conjunctiva become dry. Deficiency in any component of tear film results in dryness due to appearance of dry spot on conjunctiva and cornea. This condition can be comparable to Shushkakshipak, Parishushka netra, Astivishka netra, Asanigdha netra. We have treated the 20 patients, and the which treatment we in SMBT we had given. I just highlighting you the group prepared of Haridra and Daru Haridra. Okay, we are giving the Tarpana for 7 days, repeated interval of 15 days for 3 months, and internal admission of the same group 5 ml OD before food for 3 months, and taking the follow-up intermittent and last follow-up is 6 months. Next slide, please. This is the graphical presentation of the patients after the Tarpan and oral treatment. The dryness relief for 17 patients, no relief for 3 patients, blepharitis 14 patient relief, no relief for 6 patients, and all this data on the, in front of you. Okay, the response is good, very nice response for dry eye syndrome. Next slide, please. Then again, computer vision syndrome. Computer vision syndrome is commonly ophthalmic problem in day-to-day ophthalmic practice. Computer vision syndrome is commonly occurring ophthalmic problem in day-to-day ophthalmic practice, often presents with blurred vision, burning eyes, tired eyes, eye strains, sore eyes, dry eye, and red eye. Okay, the treatment what Ayurveda can give to for the computer vision syndrome, the Patoladi growth for topical Tarpana. Okay, the dose of 20 ml for Tarpana, 7 each eye, 20 ml for each eye for 7 days, and Yeshtimadu is Yeshtimadu in the form of topical eye drops, 2 drops 3 times per day for 1 month. Follow-up, during the follow-up study, Yeshtimadu drops twice a day suggested for 3 months. Next slide, please. This is the graphical data of after the treatment of for computer vision syndrome. The blurred vision before treatment for 8 patient, then after treatment 2 patient, burning eyes for if Okay, next slide, please. Then many a times, most of the patient comes in the OPD for the pain in the eye. Okay, this is the management of painful ocular condition. Pain and discomfort are the commonest presentation of ocular disease include extraocular and intraocular inflammatory condition, in which diseases we occur this, that is acute congestive glaucoma, then ocular trauma, referred neurological pain, vascular conditions, and other painful conditions of non-specific etiology. बहुत सारे केसेस में हेडेक होता है लेकिन कोई ऐसा कॉज नहीं होता है. Analgesia is the most urgent need in such a condition that provide aminoperation of routine work of the individual. Okay, अभी मॉडर्न में जाएंगे, हेडेक है तो पेन किलर देंगे अपने को, बट उसके साइड इफेक्ट बहुत होते हैं. द चार्ट इज इन फ्रंट ऑफ यू. If we may give the endomethacin, but its side effects on eyes, it reduces the color vision. It causes the retinopathy. It causes diplopia. Okay, these are the side effects of an oral endomethacin. If we give ibuprofen, the adverse effect is blurred vision on the eye. If we give steroids for managing the pain, the adverse effect, it may cause cataract and rise in intraocular pressure. Okay, then what Ayurveda can do? Next slide. The painful management के लिए जो आयुर्वेद में ड्रग्स है, दारवी, that is Berbera aristata, then Bhrungaraj, Eclipta alba, Nimba, Melia asdirecta, Manjista, Rubia cordifolia, Guduchi, Tinospora cordifolia. Next slide, please. For example, Rubia cordifolia, if we can, how we can manage the pain in the form of Rubia cordifolia. Okay, the condition, if it is the acute conjunctivitis, the pain in acute conjunctivitis, the decoction ashtotan for 7 days of Rubia cordifolia. Then if the pain is of dacrocystitis, then decoction ashtotan for 7 days. If the pain is by dry eye, then use the Rubia cordifolia growth tarpan for 7 days. This is the data of patient we treated. 20 patient of acute conjunctivitis treated, 60 patient get the relief. Then dacrocystitis, 30 patient treated, 10 patient get the relief. Dry eye, 10 patient treated, 5 patient get the relief. So the Ayurvedic drug also have equal effect on the pain, ocular pain management. Next slide, please. Then simple allergic conjunctivitis. Okay, the drug, what we can use in Ayurveda, that is Daru Haritra, Berberis aristata. Ophthalmic use and indication of the Daru Haritra, it is Netra Arjuna Hara. It is analgesic ophthalmic action. Netra Kandu Hara, anti-allergic action. Kaphaja Abhishanda Hara, effective in allergic ocular condition. Depression effect of histamine, 5T and bradykinin. Anti-inflammatory property of acute, subacute and chronic models of inflammation. In allopathy, simple allergic condition, we use antibiotic plus steroid or biptostatin. But Daru Haritra has nice result in simple allergic conjunctivitis. Next slide, please. Then selection of drug of the Daru Haritra. The fresh decoction prepared with rook bark powder of Daru Haritra. The method of preparation, 1 part of the powder of drug is added in 16 part of clean water and boiled on mid-fire until approximate 1/10 remain of the liquid and filter it. Procedure of Ashtatana, installation of 10 to 15 drops of medicated decoction into the conjunctival sac when eye is completely open and patient in supine position. The schedule of administration, all patients selected for the study were treated with Ashwatthana for 7 days and repeated the procedure for the same period or at an interval of 1 week. After 1 week, we can repeat Ashwatthana. Next slide, please. This is the graphical presentation of management of pest. Next slide, please. What is the responses of the allergic condition? Complete relief of all the presenting symptoms, 30 patients, 57.7, and complete relief of certain presenting symptoms, 22 patients, 42.3. Next slide, please. Then next disease, diabetic retinopathy. All of you know diabetic retinopathy is also most commonest problem, and it's the challenging work to the ophthalmologist. What modern system does, they repeatedly give the lasers, repeatedly give intravitreal injection, but the results are quite less. Okay, then what Ayurveda can do in diabetic retinopathy? Line of treatment of diabetic retinopathy, we can choose the Chakshusha drug that improves the visual acuity. We can choose the Netra drug that conduces to the Adnexa. Then we can choose the Timirahara drugs beneficial to disorders of vision. What is the aim of this treatment? To achieve the improvement of visual acuity and most important achievement, arrest in further progress of diabetic retinopathy, no further neovascularization and intraretinal hemorrhage. ये ट्रीटमेंट का रोल क्या है? डायबिटिक रेटिनोपैथी 100% क्योर होगी या नहीं होगी वो पार्ट अलग है, लेकिन उसका विजुअल जो एक्शन है वो डे बाय डे ड्यूटेरेट नहीं होना चाहिए या रेटिना में हेमोरेजेस नहीं होना चाहिए. पहला अपना उसका ये रहेगा कि ये अपना अचीव करना चाहिए. नेक्स्ट स्लाइड प्लीज. अभी डायबिटिक रेटिनोपैथी में क्या यूज कर सकते हैं? हरिद्रा है, कर्कुमा लौंगा, आमलकी है, एम्लिका ऑफिशियानिस, बिबितका है, टर्मिनेलिया बेलेरिका, हरितका है, टर्मिनेलिया चेबुला, दार्वी दैट इज बर्बेरिया अरिस्टाटा. ओके, देन नेक्स्ट स्लाइड प्लीज. पुनर्नवा, पटोला, चंदन, निम्ब, गुग्गुल, बला, पिप्पले. अभी आप ये जो सब ड्रग मैंने बताए तो उसमें मोस्ट ऑफ ऑल है ना डायबिटिक, एंटी डायबिटिक. हरिद्रा acts on metabolism, immunity. Amalaki lowers the blood sugar. Bibitaka improves the blood sugar level, insulin sensitivity. Haritaki manages the diabetes. Darvi anti-hyperglycemic and antioxidant है. पुनर्नवा anti-inflammatory है. पटोला anti-diabetic है. निम्बा anti-inflammatory है. गुग्गुल मैनेज करता है शुगर लेवल. बला जो है वो मेंटेन द हेल्दी इम्यूनी सिस्टम एंड पिपली यूज एज ए रसायन. So you can give in many mode of action and in many forms these drugs in diabetic retinopathy. Okay, in our SMBT, what we are giving the treatment to the diabetic retinopathy? So we are giving the Tarpan of Patola Grutha for 7 days at an interval of 15 days for 3 months. Then internally, tablet Nishamalaki 5 milligram PD. Then Chandraprabhavati and Punarvanavasa 25 ml BD. They are giving a nice result for diabetic retinopathy. The frequency of lasers is also reduced. Hemorrhage is also reduced by this treatment. Next slide, please. So, what is the justification of the diabetic retinopathy? An ideal treatment of diabetic retinopathy includes the following factors: control of blood glucose level, control of hypertension, liporeduction, prevention of macular edema. And what is the conclusion? It could be concluded that endogenous compound drug schedule may successfully employed in diabetic retinopathy. This effect may be justified that anti-diabetic, anti-hypertensive, liporeducing agent conducive ophthalmic correction, particular with vision ingredient. Long-term studies is more number of cases in greater detail will provide the further insight of this subject. Okay, this is all about the diabetic retinopathy. So next slide, please. Back जाओ, फैजल back जाओ. Okay. So ये जो आज सब्जेक्ट था कि recent advances in Ayurveda ophthalmology. Okay. So I have tried to evaporate these all the subjects. There are also many myopia hai, age-related macular degeneration hai. Due to the lack of time, I have not covered this subject. But at the end of this session, I just want to highlight some point at conclusion. Okay, I want to say the oldest pathy in the medicine is Ayurveda pathy. It is accepted all over the world nowadays. It is said that जहां न चले कोई उपचार पद्धति वहां चले आयुर्वेद पद्धति. ये जो है अभी आपने देखा ये सब कि जहां मॉडर्न ऑप्थेल्मोलॉजिस्ट लेजर कर रहे हैं लेकिन इफेक्ट नहीं है. ग्लाकोमा पे भी लेजर कर रहे हैं, ट्रीटमेंट कर रहे हैं, लेकिन नो रिजल्ट. आयुर्वेद में बहुत सारा कुछ है कि कर सकते हैं. यस, इट इज ट्रू दैट आयुर्वेदा इज एन अल्टीमेट पैथी. Those who are defeated by all other pathies come finally to Ayurveda. The type of medicine Ayurveda has, allopathy never had. जितने मेडिसिन आयुर्वेदा में है उतने मेडिसिन एलोपैथी में नहीं है. When you study Ayurveda properly, then you can treat well. जितना तुम डिप में जाएंगे उतना आयुर्वेद रिजल्ट देगा. यहाँ कहिए हर उपचार का अंतिम शब्द है आयुर्वेद. जय आयुर्वेद, जय शालाक्य. Okay. Lastly, next slide, please. Lastly, I am very much thankful to all the organizers for giving me this opportunity. Thank you. Thank you very much.
Thank you, Pirke sir, for giving us a very much important topics covered by you. These are in day-to-day routine practice in ophthalmology, like as an retinitis pigmentosa, chronic simple glaucoma, then diabetic retinopathy. In these modern advances, we should give approach by the Ayurveda. In modern, we should give last for the glaucoma, TSCP, transscleral cyclophotocoagulation, but end result is that patient's body is gone, eyes is bulgy, and in a diabetic retinopathy, we are giving 3 to 5 settings and Avastin, but you are giving very much importance in day-to-day practice for using this Ayurveda practice is very much good and informative to all of us and new students, newcomers, new practitioners. It is very much informative. I will hand over to the session's chairman, Dr. Jayant Wak sir, for giving some keynotes on the sir's lecture.
Good morning. Today's session co-chairman, respected Dr. Nutan Reddy Madam, Secretary Dr. Sunil Vadivadikar sir, Coordinator Dr. Chandrakant Gosavi sir. Thank you to me give a opportunity. Dr. Tushar Phirke sir cover all points and delivered skillful and knowledgeable speech and really advanced speech to deliver Dr. Tushar Phirke sir. Thank you sir. Currently people are turned to our Ayurveda treatment. If we do more research in Kriya Kalpa and use it in patient, I think it will get good response in day-to-day practice. Thank you to give organizing committee to give me this opportunity. Thank you, thank you, thank you.
Please give both of hands. Thank you, sir. Please, I will invite co-chairman, Nutan Madam. Nutan Madam. Co-chairman.
Nutan Madam. Nutan Rade Madam.
Earphone.
Dr. Nutan Rade Madam, are you getting me? I think ma'am is connected, but is might be she is out of her mic will be mute one. Yeah. Ma'am is there. Yeah.
Madam, please.
Hello.
Hello.
Ma'am, yeah, you are audible.
You are audible.
Yes, good afternoon, everyone. On occasion of Azadi Ka Amrit Mahotsav, 75th anniversary of independence of India, a national webinar on recent advances in eye ENT disorders and importance of research methodology and statistics is arranged under the theme of Hamara Ayush, Hamara Swasthya, and Ayurveda for Nutrition by Shalakyatantra Department of Yashwant Ayurveda College. I thank Director of Ayush Government of Maharashtra, then MUHS office bearers, then MCIM Mumbai office bearers for giving me opportunity to be a part of this national program. I thank Principal and HOD Dr. Sampath Bhatane sir, Dr. Dipti Nene madam, organizers, whole Shalakyatantra department team for arranging such an excellent webinar. I thank Dr. Tushar Firke sir, today's dynamic guest speaker for this session, for giving a lecture on recent advances in Ayurveda ophthalmology and its management. Although this is very vast topic, sir has nicely covered all the points in short lifespan. I thank chairperson of the session, Dr. Jayant Wagh sir, for his valuable remarks. I also thank Dr. Secretary of the session, Dr. Sunil Vadewalkar sir, for introducing today's guest speaker. And I thank Principal and HOD Dr. Bhatane sir and whole team. Again, I thank all the organizers, coordinators, senior colleagues, and fellow Shalakya for attending this webinar and making it a grand success. So thank you everyone, and over to you, Dr. Gosavi sir.
Thank you, madam. Thank you, Bhatane sir. Thank you, Patil sir, for organizing such seminar. It is very much informative for all of us. Thank you.
Thank you, sir. Thank you, Gosavi sir. Thank you very much. I think we are moving towards the last session of this webinar. The scientific writing and publication skills is the topic of this fourth session. For this purpose, I invite the coordinator, Honorable Vaidya Ranjit Patil, to continue with this session. Thank you very much. Over to you, Dr. Ranjit Patil.
Thank you, sir. Am I audible, sir?
Sir, yeah, you are audible.
Okay. Good afternoon, everyone. Myself, Dr. Ranjit Singh Patil, Assistant Professor, Ayurveda Medical College, Pet Vadgaon, Kolhapur. I am coordinating the session in this webinar, Scientific Writing and Publication Skills, which will be presented by Honorable Dr. Abhijit Survase, sir. For this session, we have Honorable Dr. R.S. Dhate as a chairman, Honorable Dr. Rajesh Fasate as a co-chairman, and Honorable Dr. Rekha Matkar as a secretary. So I request Dr. Rekha Matkar ma'am to introduce our speaker, Honorable Dr. Survase sir. Over to you, ma'am.
Thank you very much, sir. Am I audible?
Yes, ma'am, you are audible.
Okay. Now giving just introduction to Dr. Mr. Abhijit Survase, sir. He holds a PhD in biotechnology from the University of Queensland, Australia. He worked as a research fellow for 4 years at the Queensland Alliance for Agriculture and Food Innovations. Later, he was scientist for 2 years in Pune and now editor-in-chief, Safe Right Research Writing Services. He works in field of publication and academic content writing. He himself has 2 very high impact factor publication in Elsewhere and Bailey. He has in-depth knowledge of research, writing, and publication. He also has reviewed research articles in Elsewhere. There can be no doubt that he is an excellent resource for teaching us how to write and publish the research. So I'm requesting him to start the session soon.
Thank
Yeah.
you, ma'am.
Am I audible to everyone?
Yeah.
Yes, sir. You are audible.
Yes.
Yeah. Okay. So I thank you all for providing me the opportunity to present over here. And I should really appreciate the entire management team because they have been keeping a track of the time and managing everything right on spot of the time. So I thank all of the administration and organizing team over here who had provided me the opportunity to present regarding scientific writing and publication. So without wasting much of the time, I will just start. We will be falling short of time today, I guess. So let me share my screen for this regard. Yeah. So I just hope my screen is visible to you all.
Yes, sir.
Just a moment. Yeah, is my screen visible to you all?
Yes.
Yes, sir,
I'm
it is
sharing my
visible.
presentation over here. Yeah, okay. Okay, so I was provided the topic of scientific writing and publication skills. I am Dr. Abhijit Survase, PhD from University of Queensland, and I'm not an academician as such, but I assist the academicians in research article write-up, drafting, and in publication services. Name of my enterprise is Safe Right. So yeah, when I came to know about this topic, I have to present it in Shalakya department. I just had the opportunity to look into the publication sector of Ayurveda, and then it really intrigued me because there's a lot to work over here with regards to publication. Now, publication in Ayurveda, as per my opinion, is an underlooked sector. Why do we need publication as such? You see, when you are considering development of any country, the human, social, economic, and environmental growth is important. That are all of the sectors which are going to make a country develop one. But when you are considering every sector which has to be developed, you need these parameters: education, research, and publication. When you educate a certain social sector, then people research over it. When they will research, they are going to write something regarding the research that becomes the publication. Now, this publication is always revised in your academics, and then it is again incorporated into your education. Now, these are 3 very important pillars. Even in Ayurveda, it is the same. Now, it's nothing new to say. I'll say the oldest publication sector was in India. It initiated in India. It was documented in the form of Vedas. It's debatable whether it was human made or it was God made, but whatever may be, there was research, there were diseases which were discovered, there were treatments which were discovered, and then they were written in some manuscript forms. You see, now those were written in the manuscript form, and that is the reason we can study it right now. So you have to educate yourself, perform some research, and then publish it so that the forthcoming generation is going to read about what you have worked over. See, so that is the reason publication is important. Now, many of them are always engaged in the academic course. Okay, so besides the academic course, what benefit they are going to get from publication? First and foremost, there is a social cause, because you all are medicos. Whatever you do is going to certainly improve the health of people. So there is a social cause why you should publish. People will read what treatments you are preparing. Secondly, it is going to increase your H index. Now, many of these things, about 90% of the things, might probably be due to you. If you all feel that this thing is new, you can just immediately take a screenshot or something. H index is something which is recently introduced by Scopus. Number of citations which a particular scientist gets, it's a H index. Now, when your H index is going to increase, your credibility is going to increase. Credibility in sense, people are going to know that this is a particular person who has been working since very long over a particular disease. Now, that is also important for increment, as I know there is something called as API score for assistant professors. The more publications you do, you get increment for that. And now recently it is also become a requisite for PhD. So if you are pursuing your PhD, you need to have at least 2 research publications. It might be a Scopus indexed publication or a UGC care listed publication. If these things or terminologies are new, I am going to go in depth very quickly over those. Now, when you are considering a research article or any kind of publication, the publication can be of about 11 to 12 types, but then it would be very difficult to cover all of those in a single lecture. So the most important or majorly published manuscripts, I'm going to speak about that. First one is the research article. Whenever you have any master student or a PhD student and he comes to a guide and says, sir, I'm going to work over a specific topic, you will always say, go and do some literature review. What's a literature review? You actually intend to tell them that see what previous work has been done. That means what previous research work has been done. So students will go and read a research article. If there are graduates and postgraduate students and research article terminology is new for them, a research article will always be in a format of I am rad. This is a shortcut. I'm trying to make it very simple and easily digestible to you all. A research article is always going to be in I am rad format. So I stands for introduction, M stands for material and method, R and D is results and discussion. And rest of the things are of less importance. Less importance in sense, these are short segments. Conclusion is not going to be more than 500 words. Title abstracts, these are not going to be more than 500 words. But this makes the body text, introduction, material method, result, discussion, and conclusion. And then there are tables and figures, and then you provide a caption and then mention that in your article. Then there is case report. Now, a research article and a case report is different. In research article, you have a particular question. Supposing you prepare a new drug and you are providing a hypothesis that the particular drug will cure bleeding piles. So you will initially give introduction to bleeding piles. You will provide a detailed material and method. Then you will provide the results of the drug. You will discuss what would have happened in the body so that the drug has made a treatment, and then you will conclude something over it. Okay, and then you will have some supporting tables and figures in that. A case report is comparatively different. Now I'll give you an arbitrary example. There is a person who is gone on beach and he's going to have a sunbath, but then he's got some sunscreen. It's take an arbitrary company's name, Komodo Dragon. So the sunscreen company name is Komodo Dragon, and they have given a precise information that do not heat it, keep it in cold condition. And then he kept it in the sun, and now he sprayed that sunscreen on his back, supposing on his skin. And then the second day he got some rash. He went to the doctor, and then the doctor observed some irregular rash, which he had never previously observed. Now, what he's going to say, what he's going to report over here, that there was something new, a rash that was developed. He's going to ask the patient, he's going to get a detail about the case, that what had you done because of which you feel that this rash has occurred. He'll say, I just applied some sunscreen. Then the doctor just observed that the sunscreen had to be kept in cool and he kept it in hot. And maybe there is some chemical reaction which happened. And then he got the boils or rash. Now he's going to present the case that a specific condition was there, specific case had happened. The company Komodo Dragon sunscreen lotion was heated and then he got a rash. Now the case report, when it is published, other scientists are going to read about it. Now the doctor, the first doctor who had seen the case, he will also give some medication, and that is called management. And then afterwards, he will discuss on what happened when he gave the medication. He will conclude and he'll also mention what investigations he did. So that is a case report, something new you observed. And then you are going to mention that a specific non-ordinary case has been occurred. And then if you all feel that the same has been occurring towards you, specific is the management which I did. So that is an important factor as well. Case report. Case report is something new that happened. Case report is always going to be in the format ICMAD. Okay. So let us have a demonstration of this. I'll minimize this. So first is the research article. Let us see a research article. The research article, as I said, is always going to be in IMRAD format. So the first is I means introduction. Then second one is material method. Then the third one is result. IMR, results. And then D, discussion. Okay, so when you are writing a research article, it should be in IMRAD format. But then, as I said, a case report is different. Case report is going to be in the format ICMAD. So that will be introduction, case presentation, management, discussion, and then conclusion. Okay, ICMAD. If you want, you can take a screenshot. Now let us see a case report over here. So yeah, so the abstract first, then see introduction, IC, case presentation. Then there has to be management, then discussion and investigations. Okay, so that is the way you have to present your article when you are giving a case report. Now this happens to be about reading the manuscript. So I'll show it once again. This was how a manuscript is visible to you all. It is in IMRAD if it is a research article, and ICMAD if it is a case report. But then now we are to start writing a research article. When you are starting writing a research article, it is not going to come in the format how you see the manuscript. You have to start writing it in the opposite direction. You see, a research article comes in this direction. The title first, abstract and keywords, then introduction, then material method, result, discussion, and conclusion. But when you are writing a research article, it goes in the opposite direction. What you're going to do, you're first going to mention all of the methods, what you did. You will write the methodology. Then when you perform that method, you get some results. You're going to mention the results. Then you are going to discuss about those results. Yeah. So you get methods, you compile your results, you have the tables and figures, and over that you are going to get the discussion. Now, once you have that, you'll write the conclusion. Now you see what we did was we first consider all of these sections: methods, result, discussion, tables, and figures. Now you know everything that has been done in this research article. Now based on that, you will write your introduction. Abstract and title is something that you prepare at the very last, because abstract is going to be a trailer of your manuscript, and it has to be in such a way that it will include all of the parameters that you have included in your research article. Okay, so when you are going to write a research article, you'll start from methods, then take your tables and figures, compile your results, and then discuss over it. Okay, now this is about how you're going to initiate writing your research article. As I said, there are many parameters in a research article: abstract, methods, result, discussion, introduction, everything. You are going to have a very concise format in which you are going to write every aspect of your research article. So the first one is always the abstract, which one, the one which you read. As I said, your abstract is going to be the last section which you're going to write, but every abstract has to be in a typical 200 to 300 word format. When you are going to go into elsewhere or Scopus public index journals, many of the articles mention the word limit of your abstract, but then if it is not mentioned, it has to be, it is just considered that it has to be in 200 to 300 words. Every research article will have a limited word count. Now, when you're writing a research article, there is a structure how you should start your abstract and then how you should end it. So the first 3 to 4 statement is going to be ask the purpose of your research and what problem you solved. Then methodology in the middle section, what was done and all of the data in brief. Then the key findings and arguments. So these 3 sections you are not going to understand right now. I'm going to show you a demonstration how you can correlate that with a actual elsewhere publication. So what I'll do over here is go into a research article. At times there is not going to be an abstract. As you see, this research article doesn't have an abstract. Okay, but then abstract can be a graphical format as well. Let us see this research article. I'll go in my browser and paste this research article and then try to understand why the abstract was not given. So let us see. Okay, so it has a graphical abstract, not in the word format. So entire research, what they have done is shown in pictorial form. So you don't need to read it. The visual influence is going to make you understand everything what has been done in this research. Let us consider some other article. Yeah, okay, Ayurvedic management of amoebic liver abscess, a case report. Now this one is a high impact factor journal. Okay, so consider this abstract. So as I said you in my presentation, ask the purpose of your research, why you have performed this experiment. Okay, let us see if it goes in that format. Liver abscess are purulent collection in the liver parenchyma and thus result in bacterial and fungal parasitic infection. So it already mentions why you are taking this research. The antibiotic, percutaneous drainage and surgery are the only therapeutic solution for this condition. So in the first 2 statements, they mention why you are pursuing this research. A 30-year young gentleman, a diagnosed case of multiple amoebic liver abscess, visited the All India Institute of Ayurveda. He came with complaints of rectal bleeding. So in the next 2 to 3 statements, he is going to present the case, what has been done. Okay. Now in the next 2 to 3 statements, you are going to show what methodology was performed. So see, in this case of liver abscess, after taking informed consent of the patient, the patient was given an Ayurvedic treatment for 60 days without any allopathic medicine or any invasive technique. So you see, now next 2 to 3 statements are going to be what methodology you are going to pursue. And after that, there were no signs of clinically significant adverse reactions. These are the conclusions. Yeah. And the last 2 statements, the treatment outcomes in the present case indicate that classic Ayurvedic measures may be helpful for patients of liver abscess. So that is the way how you are going to present your abstract. Okay. So if you want to take a screenshot of this, you can take it right now. Ask the purpose of your research, methodology section in the middle, and then what are the key findings and arguments. Now, keywords is not something new you should know. Keywords is something that when you Google search something, you get the relevant research, you get the relevant outputs from that. Okay. So keywords is something that when you search, your research should come up. So you should think that the keywords should be such that your article should have those words inside. And then when people are searching over it, your article should come up. A graphical abstract is a schematic representation of the work. I showed you the research article. It didn't have the word format of abstract. It had a graphical representation. And abstract, you have to write it at last. We'll move forward to next section, which is the introduction section. As I said, IMRAD. The first one should be introduction. So in introduction, you are going to state what problem has to be solved. An introduction, let me tell you, is not going to be more than 600 to 800 words. It has got a fixed format, how you should write an impactful introduction. First would be why you are pursuing this problem. Then what are the existing solutions for that? Which one is the best? If it is the best, what are more limitations in it? And then what you are going to perform in this experimentation, which is going to cope up with that limitation. Okay, so introduction should come in this format. If you wish, you can take a screenshot of this for now. Now it will span for 600 to 800 words, and it will have many citations inside. Citations are something that a particular reference which has been credited to that statement. These references, these can also be used in discussion. I'm going to tell you in depth about citation, how they are added in your research article, how I use EndNote. I'm going to show a practical demonstration of that. The next section is materials and methods. Material and method has to be very stringent. Now, I know in Ayurveda, the material method section is very precise, but then there are new methodologies which you scientists can also develop. And when you are doing that, you have to take care that you have to write the material and method section in such a way that any person across any corner of the globe can reproduce that result. So if he reads a particular methodology, he can reproduce the same effect anywhere else. And that is very important when you want a very high impact factor journal publication. Your experiments should be reproducible, not that you kept some variable factors at your experimental place, and then you didn't mention that in the discussion, and now you are not aware whether the variable parameters of your workplace were actually influential in your results. So never do that. Mention all of the aspects of your investigations. So if you feel like they affect your results, it has to be mentioned precisely. Try to standardize the methods for investigation. If you don't have a standardized method and you are framing on its own, you need to peer review it. You need to see any variable factors are influencing your investigation. Always use SI units of measurements. It may be kilos, grams, not in ounces like European countries do it. Try to replicate the data wherever possible. Now, statistical calculations are very necessary, and for that you need replicated data to see if your investigations don't have a lot of standard error in your means. The next one is sample size. When you're writing material and method, sample size in your case is very, very important factor, because it also calculates, it also regulates what charge is going to be incurred in your research. So the more number of patients you are taking care of, the more amount of money you have to invest in your research. So sample size has to be a golden mean of amount of money that is involved in the research and the necessity to give significant results. Statistics is a must. You all perform analysis of variance, but with analysis of variance, there is also something called as post hoc analysis, that even if your means vary from one another, what is the significant value because of which we can say that, okay, that these particular means are significantly different from one another. So post hoc analysis, it's difficult to understand for now, but then post hoc analysis is something new you should give a read about. It really adds to the gravity of your article. Then your manuscript has results and discussion section. Now results and discussion section is nothing to speak about. Results is going to be about it's only going to be the results based on what material methods you pursued. You're going to use SI units for the measurements. In results, whenever you tabulate all of the results, you're going to get some mean values, and those mean values if they are replicated, you have to find the standard error in those values. If the standard errors in the means are very high, it is considered that those means are not proper, and then those methodologies were not performed properly. The result should not be biased. Whatever results you get, you don't have to force that, okay, my result was positive. You don't need to emphasize only positive aspect. Research publication is something you have to mention every aspect, whether it is positive or negative. The discussion section is the most difficult part. If you are a student, I'll recommend that discussion should be written in liaison with your mentor or your dean or your research guide, whosoever may be. It shouldn't be biased. It should also mention what shortcomings were there in your research article and how they can be circumvented if someone else is pursuing the same thing. In the discussion section, you should also focus how your research can be applicable to the society as a whole. You see, when I tell every time that how this research is implicable, I need to emphasize that when you are trying to target your research article in a high impact factor Scopus indexed or Web of Science index journals, your article should be implemented everywhere. It should be repeatable. It's not that in India, your treatments are based on rutus. You need to mention specifically that we had a specific climate over there. The temperature was as such, relative humidity was as such. And after that, this climate is going to impact on the procedures. When you mention that, the people in Western regions are going to understand that, okay, so climate is also one of the factors that is influencing the health of the person. The same is not considered in allopathic medicine, up to my understanding. So you see, proper mentioning of material and method and proper mentioning of results is something lacking in Ayurvedic medicinal publications. So I feel that is the reason most of the research articles don't land in high impact journals. Now, high impact factor journals are something like Elsewhere, Wiley, Nature, Taylor, and Francis. Now, these are very big publication houses. The biggest publication house is Nature. It's a very costly publication house. The next one is Elsewhere. I have got myself published in Elsewhere. My second article is in Wiley. And let me tell you, it's a salt pepper kind of thing. It's also difficult to get published in a high impact factor journal. But if you keep a proper structure and rules and regulation, as I mentioned previously in my presentation, if you make your article based on that structure, you can get yourself published in high impact factor journals. Now, these terms should be new to you: UGC Care, Scopus, Web of Science. I should give you a practical demonstration of that, and you're going to understand what is. Let us go on Scopus. Or first, let's start with UGC Care list. I'll go in UGC, and if you want, you can note down the website ugccare.unipune.ac.in. I just go into the website and I hit the login button over here. I just try to log in. I will log in with a user ID and a password and then hit on login. Now, let us see the dashboard of this. The UGC Care list. It has group 1 and group 2 journals. Now let us read over here. The UGC Care list has only 2 groups instead of original 4 groups to simplify the search process. These are not hierarchic or rank groups. So these are 2 independent groups. Group 1 is going to be the list of journals which UGC Care is going to validate every year and then put it in the UGC Care list. So group 1 is going to be Indian list of journals which has passed the criteria of UGC Care. Okay. And then UGC list group 2. These group 2 are going to be globally recognized database. Globally recognized database in sense, there is an institution called as Scopus or Web of Science, which rank the journals. If your journal is a better and a high impact factor journal, you can apply for Scopus indexation or Web of Science indexation, and that is falling under UGC list Care 2 group, UGC Care list group 2. Now let us concentrate on UGC care list group 1. This is UGC care group 1. Whenever you're going to search in this dashboard, it is going to be group 1. And now let me search it on title. And let us select Ayurveda. I'll just hit Ayur and then click on search. And you see, this is a very alarming condition. When I search a query as Ayur, there are only 5 journals in UGC care list which are actually related to Ayurveda. And 2 of those are actually controlled by Central Council of Research in Ayurveda Science. So there are no third party or private journals which are actually considering the publication of Ayurvedic medicine. So if you all are academician, I feel like this is an alarming situation. We need to do something about it. Now these were for your convenience. What I've done is I have created a Scopus Web of Science and UGC care listed group of journals, journal list based on Ayurveda and traditional medicine. So I hit 2 keywords, Ayurveda and traditional medicine, and I found some journals which can publish Ayurvedic research in those, and that would be available to you on the group. If you wish, you can contact me as well. I'll share you individually. Now these are UGC care listed journals. Let us see what is Scopus. Now I have already logged in my Scopus account. What I'll do is I'll go on Scopus list of journals. Okay. And then this is the dashboard. I'm Abhijit Survase and my institution is University of Queensland. So I have a university access to Scopus. I'll hit on subject area over here and let us try to search with the keyword Ayurveda. I'll not hit many words over here. I'll just hit Ayur and hit enter. Oh no, sorry, it's not the subject area. It has to be title. So let us go AYUR and then hit find source. And you see there, I don't find Ayurvedic journals in ample over here. Let us go on. Let us go on my list which I have prepared. Let me go on the group BHR. And click over here. And then I'll go on the Excel file that I have provided you. Save and I'll open it. Now, yeah, so this is the Excel file that I have provided. As I said, you all, the UGC care listed journal were only 5. And what I have done is I have given the links of those journals over here. The second one I said was Scopus list of journals. When I went into detail, the Scopus listed journals were these many. Ayurveda, Advances in Traditional Medicine, Journal of Ayurveda and Integrative Medicine. This was the only high impact factor journal that I found, which was Scopus listed. And then rest of the journals, if you see, let me maximize this a bit. There is just one research article, there is one journal which has the name Ayurveda in it, and rest are all traditional medicines. Now, traditional medicines are going to be an amalgamation of all of the traditional medicine, maybe Chinese, Unani. But if you are specifying about Ayurveda, I just found one journal. Now, let us concentrate on that journal. Enable editing. Yeah, let me concentrate on this journal and then go back to the browser and then hit on this one, Journal of Ayurveda and Integrative Medicine. So this is one elsewhere journal. Okay, Journal of Ayurveda and Integrative Medicine in elsewhere. So yeah, just one journal in Scopus indexation. How do you all feel? I feel like India has been practicing this medical science since many, what do you say, yugs. And then even then we have just one research, one journal which is Scopus listed. That is alarming. We need to do something about it. Now, when we consider high impact factor journal, what we actually see is the citation. When you say citation, what is the cite score of that? It's got a formula for that. Now, suppose I have a journal and I publish 100 research articles. But if I publish 100 research articles in a given year, how many of those articles are referred by others? Supposing my research articles, out of those 100, 10 research articles are cited by other people. Then what they are going to do is 10 divided by 100. So my impact factor is going to come 0.1 something. So yeah, so 0.1 would be the impact factor. So when you are considering a journal, you need to see that the research articles published are of better standard so that other people are going to refer it. Now that is the reason, because of the lack of citations, most of the Indian journals go into Scopus, but then Scopus has a very stringent regulation policy because of which Indian journals don't stand over here. After a year or two, they just come out. There were two journals, International Journal of Ayurveda Research and International Journal of Research in Ayurveda and Pharmacy. Now they are no more. Now they are not indexed in Scopus. So this is what happens for Indian Ayurvedic journals. Now there is something also called as predatory journals. I'll give you a brief about it. So for that sake, what I have done is in this, I have put in the links of these journals. What happened once was I got a client who said that, sir, you are charging so much. People are publishing my research article in such less amount, and then they take only 10 to 15 days to publish it. Let me tell you, Scopus Index publication is not going to come in just 10 to 15 days. It takes months to get published. Now, this was the journal, the ISSN number, it says Scopus preview. You see, it is Scopus listed, it says. The ISSN number is 1007930. Okay. And what I saw, there was also one more journal with the same name, which also had the same ISSN number. Now, which one is true? Let us go in call for papers for authors, and then let's go in the processing charge of this journal. So they are charging 3,000 rupees. They will provide one e-certificate. And then if you are an international student, they are going to charge you about 8,000 rupees for that. Now let us see if this is an original case. What I did was I went into Scopus. Let me take this down. I went into Scopus and try to search the same journal over here. I'll go on the ISSN. Let us see the ISSN of this journal, 1006. 1006 dash. The second one is 7930. 7930. And let us search what's the real case. Sorry. 1006 7930, is that right? 1006 7930, and let us find the source. It's not coming up. I don't know why. Okay, so what I did alternatively is I went on Scopus and then took the link of the original journal which came through Scopus, and then I found that this was the original journal. Now let us see the difference in both of the journals. Now you see there, this is the original journal. It's a Chinese journal which has the same name. You see, Journal of Zion University of Architecture and Technology. And then this is a predatory journal, Journal of Zion University of Architecture and Technology. So this was a Scopus listed journal, but not this one. Now what people will do, they are going to make fake IDs of these Scopus listed journals, and they are going to charge you some amount. They'll tell you, we'll publish your article in just 10 to 15 days. They'll take the money, and then you are at loss, you see. you'll feel that my article is Scopus listed, and then it's not. Scopus listed journals are happening predatory these days. Now you just think about what would be happening for UGC care listed journals. So you have to take care that your article is not predated anywhere. If you are writing for the first time, I'll just advise you all to take advice help, how to search a better research article, what impact factor, which one is not predatory. You need to understand which one is not predatory. The article processing charge. Now this is something that you laugh over it. When I searched the Scopus listed journal, the Journal of Ayurveda and Integrative Medicine, the charges was $1,800. That roughly happens to be 1,44,000 rupees, and no waiver for Indian students. Then the second one was in Hindavi. The article processing charge was 2,550, and that roughly happens to be 2,04,000 rupees, and no waiver for Indian students. And then there was one more Scopus listed journal, International Journal of General Medicine and Pharmacy. The price was unknown. But you see, when you are trying to get into Scopus, the charges of the articles, they spike up so high that I feel like an Indian student is going to complete his entire research in 1,44,000 rupees or 2 lakh rupees. And then publishing your article in such a high cost is something, it's impractical. I feel it's our responsibility to work over this. We need better impact factor journals, better research, and the publication has to be eased up. Now, how do I draft? I'll give you a brief about how I draft my research articles. You see, I have something called as EndNote over here. I'll go in my EndNote library. EndNote is a citation manager. I had a client over whom I was helping over. Now, supposing I write something over here, endophytes are beneficial microbes, and now I need to add a citation over here. So what generally you do, you'll create a citation over here, something XYZ at .al comma and something a year 2011 or something. But that takes time because you have to add it in your bibliography as well. So what I'll do, I'll go in my EndNote, I'll click on the relevant citation, and then I'll hit on insert citation button over here. And now you see that the citation came automatically, and my research bibliography is also created automatically. It's not just like that. I'll write any damn statement and then go on my EndNote and put in the citation, and the bibliography keeps on creating automatically. You see? And it's not like that. If I take the citation from some other alphabet as well, like suppose it starts from D and I put in the citation, it automatically goes in alphabetical order and then creates a bibliography itself. And not only that, I'll go in EndNote and create it in numbered style, annotate, supposing it will create into annotated form, will go in numbered format. It will automatically create the citation in numbered format or APA or the font or the style which you need for your projects. So you see, it's something which you can't learn in a day. It's a bit time consuming. We can't complete everything in a single lecture. Now there is something called as databases, as I said you elsewhere, the high impact factor journals elsewhere, Science Direct, Springer, Wiley, PubMed, Google Scholar. These are all big databases, but I prefer not to use Google Scholars. I'll prefer elsewhere, Science Direct, Springer, Wiley, and PubMed. If you wish, you can take a screenshot of these databases. These are peer-reviewed research articles, and then these databases always give you very good research articles. Google Scholar will always give you any damn kind of research article. It just goes on the homology, not on the relevance and better impact research articles. It will just go on the homology. Any query, and then it will show you a relevant research result for it. But elsewhere, Science Direct and Springer, I prefer those, even PubMed. I showed you how I cite from EndNote. I create my Word file over here and then just create a library in my EndNote, put in the citations, my bibliography and my citation, both are automatically created. Okay. Now what I'm trying to do is I started my enterprise called Safe Write. I found a gap that students and the academic publisher, they have a gap. Students don't know how to write and academicians are not getting better impact researches. I'm trying to bridge the gap between those. And I'm trying to collaborate with academicians so that I can assist students in research article write-up. We have already provided training facility to many students as well as faculty as well. We help them in choosing the research topic. Then there is something called as review feature in the Word. So if you are a faculty, there are many things that if you learn, it is going to help you for lifetime. There is review feature in Word. There is SPSS statistics. There is identifying the research journals, which one is better, Scopus listed or UGC Care listed or Web of Science listed. How to use reference manager, may that be Zotero or Mendeley or EndNote. Searching the databases, which one is better, how to advertise your research articles, what is ResearchGate, how your research article can go to the masses and then people will cite your research articles. Now, how do we collaborate? Until now, what we are doing is we are trying to make good publishable manuscripts. We are providing research training, how to write, and then we target better journals. We look at the research articles and then we ourselves target which would be the best and the apt journal that can accept your research article. Our short-term goals are training students so that student will have an idea of publication and write-up. Increasing your publication numbers, students can understand what a commercial research is, which are impactful research topics, and increasing the site score of your colleagues or your peers. Our long-term goals, collaborating with institutions, are that faculty should understand what topics should be taken up. We want to improve the NAC score in the forthcoming period as well. Any DAM collaboration we do, we will take care that we increase the NAC score regarding the research, the column 3 which you have in the NAC. Then we can generate an alumni support for publication assistance. I myself have access to university library, which give you access to full-length research articles of Scopus or elsewhere, or many high impact factor journals. And I provide a non-commercial access of my library to my clients as well. Now, our academic services include training, peer reviewing your research article, publication support, research article writing assistance, grammar correction, language improvement, plagiarism scan, and removing the plagiarism. So it's a very big topic. I find I cannot justify every aspect of research article write-up and publication skill in just 45 minutes. But my goal was to enlighten every aspect of research article in Ayurveda. And a takeaway statement would be that we have very less number of Scopus indexed journals, and then it's our duty to do something over it. We had only 5 research articles regarding Ayurveda. There are many journals which amalgamate everything like traditional knowledge of Indian medicine. But then specifically about Ayurveda, if you consider that it's very less, we need to do something about it. I just try to conclude my presentation over here. I thank all of the management and organizing team for providing me this opportunity. If you feel like you need to know more about me or my services, I would be happy to share my contact. My email address is editor@safewrite.co.in. You can go on my website. You can search SafeWrite, the first link that comes up with my website. Yeah, so I thank everyone. I conclude my presentation. Thank you.
Thank you, Dr. Survase sir. Thank you for explaining the important topic very nicely. Now I request Honorable Chairman Dr. Date sir to comment on the topic. Over to you, Dr. Date sir.
Thank you, Coordinator sir, Vaidya Ranjit Patil sir. Our speaker, Honorable Abhijit Survase sir. Co-Chairman, Dr. Rajesh Phasate sir. Secretary, Dr. Rekha Matkar ma'am. And our dynamic personality, Dr. Sampath Bhatane sir, Principal. Thank you for giving me a great opportunity as a chairperson in the webinar Scientific Writing and Publication Skills. Dr. Abhijit Survase sir had described nicely and covered almost area regarding the scientific writing and publications. He has given a short forms as I am RAD and IC MAD. Definitely, we Shalaki and all the delegates use this short form regarding the upcoming our generals. Almost he had covered all the topics, but we go through the difficulties from the selection of topic from starting, that we need to focus on it definitely. Then another statistical analysis, we have also to work on it. And of course, sir has given an idea for the bibliography and references. And another important of these publications, that as we faculty of MUHS, it is mandatory to publish the publications in the research papers. Thank you for giving me a great opportunity. Thank you.
Thank you, sir. I request Honorable Co-Chairman Dr. Rajesh Fasate sir to give the vote of thanks. Over to you, Dr. Fasate sir.
Let me interrupt you all for 1 minute. If Honorable Dr. Sampath Bhatane sir permits me, before the vote of thanks, I want to share one announcement. May I,
Yes,
sir?
Yeah.
Thank you. As far as today's webinar is concerned, related with Shalakyatantra department, we being the organizers, all have performed very well. I want to congratulate all those, but you are not supposed to be leaving LEAVING for the next webinars. You are supposed to continue and promote the participants to be the part of this webinar series. And on 10th of this month only, we are conducting 2 webinars related with Shalakyatantra and Kaya Chikitsa. In the afternoon session, we have a webinar on the topic of Panchakarma, and the theme of that webinar, we have completely focused this webinar series on the PhD entrance exam, which is to be commenced on 28th August. And the topics of these webinar series are 50% of the topics are related with the syllabus which is given for PhD entrance exam, and others are for the UG students. I hope this message you all will circulate among the PhD aspirants who have applied for the exam, so that they can participate in this webinar series. Both the research methodology and statistics topics are covered completely related with entrance exam. Thank you one and all.
Thank you, sir. Dr. Fasate sir, please give the vote of thanks. Dr. Rajesh Fasate sir.
Sir, you are not audible, sir. Fasate sir, you are not audible.
Dr. Rajesh Fasate sir, are you there? I think he's
he is there. He's talking, but not audible. Maybe
not. Yeah. He's there. Yeah.
Okay, I'm audible.
Yes, sir.
Yes,
thank you, sir.
Yeah, continue.
Thank you, Ranjit Patil sir. Good afternoon to one and all on this wonderful Shalakyatantra webinar. I would like to present the vote of thanks on occasion of Azadi Ka Amrut Mahotsav. Have a golden opportunity to thank MUHS, the Department of AYUSH, MCIM, and the organizer B.R. Harne College. And special thanks to Dr. Dattatreya Patil sir and Dr. Bhatane sir, Dr. Patil sir, Vaidya Dipti Nene, and Vaidya Kale ma'am for organizing wonderful webinar. Special thanks to Chairman Vaidya Honorable R.H. Dhate sir, guest speaker, excellent resource person Dr. Abhijit Survase sir for valuable speech. Secretary Vaidya Rekha Matkar madam, coordinator Vaidya Ranjit Patil sir. I extend my gratitude to respected principal and HOD of respective colleges and participant of this webinar. We have to thank all the technical members, the efforts for this webinar. Once again, I thanks one and all. Thank you. Over to Dr. Ranjit sir.
Thank you, sir. I'm thankful to all the organizers and especially Dr. Datta Patil sir and Dr. Bhatane sir for giving me the opportunity to coordinate the session. I request the organizers to conduct the program further. Thank you. Thank you very much.
Thank you, sir. Thank you, Dr. Patil. Dr. Datta Patil. Dr. Datta Patil.
Yes, we are supposed to conclude the session so that next session of Panchakarma will proceed. So, Dipti ma'am, I think she is there, no?
Yeah. I'll call her to be conclude and give the final vote of thanks to all.
We have Dr. Ganga Sagre sir. I request Dr. Ganga Sagre sir to please share his expert comment for the whole session. Dr. Ganga Sagre sir. Hello. Dr. Ganga Sagre sir, please.
Yes. Now or after this?
Just a minute, sir. Just a minute. Dr. Ganga Sagre sir is the Dean, Government Ayurveda College, Usmanabad, and he is eminent personality in Ayurveda. Almost 30 years he is serving to the in a government service, and he is there to comment on today's webinar. Welcome, sir. You are valuable.
Thank you.
Yeah.
All respected dignitaries present for today's webinar, especially Dr. Datta Patil, Dr. Harne sir, Dr. Bhatane sir, and Abhijit sir, and all others. I am very happy to join this program. Really, Azadi Ka Amrit Mahotsav, we are conducting very nicely. The whole credit goes to Dr. Datta Patil for the Maharashtra. He has been guided us for various programs. We have conducted around 50 programs in our college and premises. Tomorrow we are going to plant some medicinal plants and other activities we are conducting. This activity, this webinar was also important for us. Our students and other colleagues are very eager to hear all speakers. I am very happy to join this program. So I am very much thankful to all other organizers and all my colleagues. Thank you very much.
Thank you, sir. Thank you very much. Dr. Dipti Mene. Dr. Dipti Mene, please.
Yes, sir.
Kindly deliver the vote of thanks to all and for this all sessions.
Good afternoon, everyone.
You are audible.
Yeah. I first of all thank the participants of first session. This eminent speaker, Dr. Atul Ginode, Chairman Dr. Deepak Sawant, Co-Chairman Dr. Raghavendra Kolarji, Secretary Dr. Milind Gore, and Coordinator Dr. Pankaj Shetty for conducting the wonderful session on guidelines and steps in the research process. Second session was the lecture was delivered by Dr. Chandrasekhar Mule. The session was chaired by Dr. Praveen Chavan and co-chairman was Dr. Suvarna Gulecha madam. Secretary was Dr. Govind Shinde and coordinator was Dr. Jayant Khara. I thank all of them to conduct that session over recent advances in Ayurvedic dentistry. The third session was conducted by Dr. Tushar Pirke. He delivered a lecture on recent advances in Ayurvedic ophthalmology. The chairman of the session was Dr. Jayant Wad and co-chairman was Dr. Nutan Radaye. Secretary was Dr. Sunil Walewadikar sir and coordinator was Dr. Chandrakant Bosavi sir. I thank them all. The last session was on scientific writing and publication skills. It was wonderfully described by Dr. Abhijit Surause sir. The chairman of the session was Dr. Dhate and co-chairman was Dr. Pasate sir. Secretary of this session was Dr. Rekha Matkar and coordinator was Dr. Ranjit Patil sir. I thank everyone for sharing their knowledge and sparing their valuable time for this seminar. I thank Dr. Dattatreya Patil sir for taking initiative and he was the backbone of this seminar. And also I thank Dr. Sampath Patane sir for coordinating the whole seminar, and each and every participant and all the principals, all the respected principals who are a part of this session. I thank all of them, and I declare the session as concluded. Thank you.
Thank you, ma'am.
Thank you. Datta Patil sir.
Thank you.
Thank you.
Okay, thank you, sir. Thank you, everyone.
Thank you, everybody. Thank you.
Yes. Thank you, Tushar. Yeah.
Thank you.
Thank you, sir. Thank you, everybody.
Thank you, Ravi.
Thank you, Dr. Bhatane.
Dr. Ravidas, Chandrasekhar Mule, sir. Govind
Thank you,
Shinde.
sir.
Yeah.
Very nice webinar, sir.
Thank you.
And very much happy to see you on online.
Yeah, after long
Okay,
time, Govind. Yeah.
Yes, sir.
Abhijit Survase, sir, with very elaborative, important speech he has given.
Thank you, sir.
Yeah. Welcome, sir. Thank you.
Patel sir, thank you.